everybody. We're going to show you how an actual TEAM CBT session works. We're going to be working with Hiral, a courageous young woman from India who has a lot of negative thinking, depression, anxiety, anger, frustration with her life, but beyond everything else, she has a voice in her head telling her, "You're not good enough. You're a failure as a mother." And if you've ever had that voice in your head telling you that you're not good enough, you're going to love this session. It's entirely unrehearsed. This is like a high wire act without a net. And I think you're going to find what happens to be not only dramatic, but jaw-dropping. I'm proud to be working with Dr. Jill Levitt, my former student and extremely esteemed colleague, both as a co-therapist and as well as a co-teacher of our Tuesday training group at Stanford. And you'll see us going through the TEAM sequence: testing, empathy, assessment of resistance, and methods in sequence. So hope you enjoy it, hope you love it, and let us know what you think. And thanks again to Hiral for your just amazingly courageous contribution of sharing your soul with all of us.
Welcome, everyone, to Inside the Therapy Room Live with David Burns. I'm Jill Levitt, and I'm really excited to be presenting this half-day workshop alongside David. And we hope that you'll learn a lot and that it will touch your heart and that you'll be able to relate and connect and learn a lot as a therapist and a human being. Our goal is now to introduce you to the volunteer that we're going to be working with today. Her name is Hiral. And David and I have never worked with Hiral before. We've actually never met Hiral before, about 15 minutes before 9 o'clock this morning when we had a chance to talk with her. And we have her daily mood log, though we asked her to partially complete a daily mood log just to articulate an event that was distressing to her. And we have that in the handout packet. And I also will share it on the slides to get us started. And we'll bring Hiral up on video and audio. Mike is going to help us to do that.
First of all, Hiral, thank you so much for joining us. And how are you feeling at this moment?
Oh, I'm feeling very nervous.
Thank you for telling us that, and tell us about that nervousness that you're feeling right now. How strong is it, and what are the thoughts associated with that?
I think I'm feeling that I hope I don't make fool out of myself in front of so many people who are, here to learn.
And how would I make a fool of myself?
I think by making mistakes.
Yeah. So it sounds like that there's a kind of a voice inside of you that's a little bit perfectionistic and telling you mustn't make mistakes. And I can imagine that creates a lot of anxiety right now. But I'm wondering if it also creates a feeling of loneliness, that here we are two people, and I would like to care about you, and Jill would like to care about you. But I'm wondering if that pressure that you're putting under yourself also leads to feeling alone.
Yes, it does.
And can you tell us about feeling alone or lonely right at this moment?
Yeah, I mean, not only this moment. I think it's been forever because uh, I think when you're thinking so much about what others will think, I think um, you just end up feeling lost and disconnected from everybody and what's happening right now.
And
And you're not able to focus also on anything.
if I understand correctly what you're saying, and I don't always get it right, so let me know when I don't. But that it's been a long time in your life that this feeling is something that's with you a lot, and maybe the feeling of alone and disconnection is something that's with you an awful lot. And
Yes.
and when I realize that about you, I just want to share that I feel a kind of sadness uh, because I know that you're a beautiful, vulnerable person, but that you're, holding a lot in, and
Yes.
hopefully we can, connect with you. And I love your smile right now. What are you thinking just at this moment?
Yeah, I'm just thinking that, yeah, you're just getting things right, that I'm not able to speak as much as I would want to right now.
Yeah. Yes. Yes. Exactly. And we'll try to. I'll try to get you to speak in spite of that reluctance. And if we do, the dam will break open and the waters will flow. I'm sure. But let's do our business. But thank you for that. I loved what you just said, Hiral. Uh, the the brief mood survey, most of the scores go from 0 to 20, and on the depression test, your score this morning, just before starting, was 11, and that's a moderate level of depression. But two of the symptoms were a lot, and that's sad and down in the dumps and discouraged and hopeless. And then some of the other symptoms, low self-esteem and loss of motivation and loss of pleasure and satisfaction in life were elevated, but not quite so severely. But that's way that more than enough depression to take the joy out of life, in spite of the fact that there's a lot of potential sources of joy with a beautiful little smart little boy, spunky little guy, and your training and your certification exam coming up, and how great it would be to unleash that beautiful Hiral who's hiding behind all of this stuff, and uh, that's the kind of miracle we're hoping for. No suicidal urges. The anxiety was slightly stronger even than the depression, 14 out of 20. That would be certainly moderate heading into the severe. And 4 of the 5 anxiety symptoms were a lot, like anxiety and worrying and tense and nervous and so forth. So you're experiencing, depression and anxiety both in pretty big doses. And then another thing that Jill, you pointed out is that the anger is quite strong also, and will be an important part, I think, of what we deal with this morning. It's as strong as the anxiety, and it's 14 out of 20. So that's a moderate to severe level of anger, and if we didn't do this test, we wouldn't be aware of that you're having these feelings and exactly how strong they are. And we can't guarantee anything, but our goal, depending on what your goals are, would be to see if we can cause some shifts in today's session. Now, the happiness, this version of the happiness scale, it also goes from 0 to 20, and your score was 8. Now, on this one, a 20 would be the greatest happiness. And so the 8 shows very little happiness in terms of feeling, happy and joyful only somewhat, and hopeful only moderately. There's nothing here that's a lot or extremely. So that of course relates to the depression, that that you're feeling down and you're not feeling a lot of joy and reward. And then another thing that came up here is with your husband, the relationship satisfaction scale goes from 0 to 30, and your score was 10, and indicating some level of dissatisfaction with all 5 areas of the relationship. And I'm sure that will play a role as well in what's going on. And then if it makes sense to you, Jill, I'll turn it back over to you and we can do a little empathy, and then we can do the daily mood log. We should probably do it early to give users a feel. And if you look at that page in your handout 4, you can see Hiral's daily mood log with a lot of self-critical thoughts. But why don't you take us from first base to second base here, Jill?
Yeah, that sounds great. And yeah, I'd like to just hear a little bit in an open-ended way from her also that we feel like we know who she is and a little bit about the context in kind of an open-ended fashion. And then as part of empathy, we can also turn to the daily mood log where Hiral took a few minutes to try to think through what some of the thoughts are that are driving these feelings. But yeah, tell us about, you, Hiral, we sent out an email requesting a volunteer and you sent me an email saying you'd love to get some help. So tell us a little bit about what you're looking for help with and some of the context.
Mhm. So I think the biggest help is that I really want to feel relaxed while I'm doing whatever. I mean, even if it's playing a role of a mother, I want to just feel relaxed and happy and not just worry about his future or his behaviors. And even if I'm, preparing for my level 3 or, attending some classes, I just want to feel as if, I can do it instead of thinking that, oh, I'm just way behind other colleagues of mine just because, my entire focus is on my son and like nurturing him up because I also feel, you know, so behind in this race when I come across colleagues who have younger kids than me. And I feel, oh my God, if they can do it, why can't I do it? And so I don't feel happy, even like, while I'm attending to my son and if I'm, doing something for myself, I feel that, I'm not doing enough for my son. So either ways, I'm not happy.
Mm. Yeah. So and again, happy to hear more about what I'm hearing you say so far and what you shared with us a little bit is you have a little boy, right? A almost 4-year-old son, and you're feeling just a lot of pressure to be an excellent mother and to do a really good job nurturing him and caring for him and raising him well. And so you're often feeling not good enough, right? You're questioning yourself and you're not able to enjoy your time with him because you're feeling so much pressure to be an excellent mother and to raise him perfectly, and then that bleeds a little bit into your professional work as well, where it sounds like you're um, training and learning this model, the Team CBT model. You're getting ready for a level 3 certification exam, and you're also not feeling good enough there. You're comparing yourself to your colleagues, it sounds like, and thinking I'm not doing as much work as they are. I'm not as prepared as they are, and the same thing in the parenting realm. I'm behind my friends who have children this age. I'm not as good of a parent as they are, and that's really zapping a lot of kind of joy out of your life. Is that am I getting you? And happy to hear more of that too.
Yeah, that's true. I mean, yeah, I think I feel so tired the whole day, despite not doing anything physically so much engaging. So, yeah, I just feel tired. And then, yeah, I just feel I'm just moving in some kind of a circle or a loop, and the loop is not getting done. I mean, it's, it's just going on and on. I'm not able to sleep well. Um, even if I try so hard to just relax, it is very difficult. I mean, it's not that easy to even relax on Sunday. As if, I'm just being too harsh on myself or, yeah.
Yeah, I was going to ask you when you said you feel so tired the whole day and you're not able to sleep very well, you're not able to relax, and tell us more. And again, we can look to your daily mood log for sure, but tell us more about why that is, when is that you ended by saying, I'm just so hard on myself. So is that it feels like you're in this kind of loop of self-criticism?
Yeah, I think, see, I I'm a kind of a person who likes, uh, to have peace and harmony and some kind of order in the house. And when I see that people elder to me, they are not understanding that what exactly is needed to be done in the house. And I'm also being a young mother. I'm also struggling so much, to um, like to manage my own emotions, overwhelming emotions, and to also to not get triggered by his behavior, and also then the unsupportive family environment. So I think that is why I feel so tired.
Mm.
That it seems like if I try to if I try to save one boat, I think I'm missing the other two ones. And
Mm.
if I'm taking care of myself and my son, then I think I'm not able to take care of the family. And I also really think that it's very important for me to take care of myself first and my son, because he's dependent on me.
Mhm.
But at the same time, it also seems that we are also dependent on our parents. So that is making things very difficult for us.
Could you tell us more about that, Hiral? It sounds like like, this kills me when I think about all the pressures on women in all societies, really. That you've got to be this perfect mother, and then wife and family, and then the professional demands. You're trying to do all of these things, in a really high level way, and just constantly beating up on yourself and never getting a chance to enjoy anything. And can you tell us more about that, and especially the anger, because you're carrying a lot of anger, kind of toward loved ones, and so forth.
And you might want to share with us and the audience just where you're located and a little bit of that kind of cultural background as
Yeah,
well, just because I think it would be we would be remiss to not acknowledge that too.
yeah. So I'm from India, and there's this state called Gujarat. So I'm from Gujarat basically, and like we still live in a joint family where I have my husband who's an only child, and we have our own family business. But uh, still, my husband is very, I mean, despite being so independent at work, we still have to, be dependent on my father-in-law for the finances and everything. So, and apart from even that, I think there's this huge generation gap also, which we are dealing with. And also, I mean, we come from a background where, like, not exactly background, but his family is such that it's very rigid when it comes to adapting to new things, or even acknowledging the fact that someone can have different thoughts and opinions and approaches and perspective towards life. So I think uh, it becomes more challenging, frustrating, and irritating for me to accommodate their needs, and at the same time to accommodate my son's need.
Mm.
So, and yeah, so and plus also, like, my own house is not in the city. So the reason why I feel so lonely is because there is just no space for me to even talk to my parents openly, or talk to my friends, because I'm not working right now. So I don't get to go out so much often. Only time I go out is to pick up and drop my son, or I have started working out recently. So it is at only that is the time when I get some time for myself, where I can connect to my friends or connect to my parents. So yeah, so it just feels too much to handle at the same time, and it is also affecting my mental well-being and physically also. I mean, I have like hormonal imbalance and a lot of things going physically.
So, Hiral, I had one question that it wasn't clear on, and then I can reflect a little more on what you said. So, are you and your husband and your son living in the house with your in-laws as well?
Yes,
Yes. Okay.
yes.
But not your parents, correct?
No, no.
Right. And so you're saying, like, it feels like you're having to address the needs of your husband and your husband's parents and your son. And so there's just a lot that you're really and very much giving to a lot of people and trying to take care of the needs of a lot of people in the home. And at this point, you're raising your son and not yet, not back to work or not yet practicing, though you've been studying and you're kind of on that road. But it feels like even maybe it would be really helpful and connecting to be able to talk to your parents and talk to your friends. But right now, you've been really stuck at home caring for your son and just feeling a bit trapped. And it sounds like you're making a bit of progress on that you've just started going to the gym, working out, taking care of yourself more, getting out of the house to drop your son places and finding small pockets of places to connect. But you're definitely feeling, that you need more of that and that's kind of making you feel more down and stressed as well.
Yeah.
And to add one more little thing, you mentioned that your father-in-law, not to be critical of him or his wife, but that they're a little rigid and slow to capture on to new perspectives. And I can recall when my wife and I moved back to California, where we now live after 20 years in Philadelphia. We were it was great because we were close to my in-laws, my father-in-law and my step mother-in-law. But we were we like to hang out with them and go to movies and stuff. But their values and understanding of life was so radically different. Even the thing of emotions and talking about emotions, what was something it seemed kind of alien to them. My mother-in-law, stepmother-in-law, couldn't imagine how a human being would ever be depressed. And so it was, and they thought when you go to the doctor, you do what the doctor tells you. There's no critical thinking, and it was just a completely different philosophy. But we loved being with them, and we weren't with them all the time. But I can imagine very well if we were trapped living with them in the same house, it would have been enormously uncomfortable.
Yeah. And plus, I think uh, they're also expecting us to live the way they are living, which is absolutely not fair. And so, like, their life is like, only the four walls of the house or the four walls of the office. And I'm someone who loves exploring, I love adventure, but then, and plus the city from where I come, I had like a lot of friends and, my life was very happening. So now that, I've come to another city, I have been married since 8 years now. And I have mother since 4 years. So like for me also, it's a huge adjustment. So one of the reasons why I also feel angry so much is that, when like I, uh, I'm trying to accommodate to someone else's need, and when it's their time to reciprocate and understand that, even my needs are supposed to be um, taken into consideration, or even I have to be taken care of. I think when that understanding doesn't come from very closed ones, I think then you feel, then you know I mean, where do you go? Mm, so it's like that.
So you're expected to take care of their needs, but you don't see a lot of people trying to take care of your needs.
Yeah,
Is that right?
yeah, that's right.
And then in addition, your life as you Know it, want to know it, is you love adventure. You love things that are happening, excitement. You have a lot of friends. And now almost all of that's kind of cut off for you. So you're almost in kind of a prison.
Yes.
Yeah. It's good to see you smile, but I can imagine it's a very painful thing. And I sure hope we can find at least step one in getting some relief on this thing, because it sounds just awful for you, Hiral.
Yes, it
You
is.
don't even have time with yourself.
Mm.
Yeah, not as much. So I just feel guilty of, taking some time out for myself. It's now that I've started working out or taking care of my health is only since the time I've gotten to know that, okay, if I don't take care of myself, I might end up getting, you know, getting into a severe illness related to my menstrual cycle and all of that. So only that is something which is, making me think of taking care of myself, because I know as it's never going to be enough, no matter how much I do for my in-laws, because they are never satisfied with whatever I do. So it's like, even if I do something for them, they will never appreciate and acknowledge. And even if I don't do something for them, of course, then there is this lot of criticism and there is this lot of disappointment that I see on their faces and in their behavior.
That sounds like a one-way street.
I do.
Give. Aaron Beck used to call that a give-get imbalance.
Mhm.
Giving, and never getting anything in return. Is that right?
Yeah, that's right.
So really sounds horrible.
And
I'll give it back to you, Jill.
Yeah, I was going to ask, I mean, two things that I think would be helpful for us to do at this point, David. One is we could check with Faral and ask how we were doing on empathy and ask her to give us a grade. And the other thing is that perhaps before or after that, maybe it makes sense to do it before it, is to go over her daily mood log with her. I'm kind of hearing, two areas of work or two areas of distress that Haral is having right now. And one is this kind of what we think of as an individual mood difficulty, right? Being really hard on yourself and self-critical, feeling not good enough as a mom and in your work and as a student, even as a daughter-in-law. So there's kind of that piece, which I think we could explore a lot more and maybe bring to life more looking at your daily mood log together. And then there's kind of a separate topic that might be related a bit, but that I think actually would be a separate focus, which has more to do with relationships and some of the anger and resentment and frustration and loneliness she's feeling as related to her in-laws and husband and kind of situation in life. So my guess is, yeah, I hear it in these kind of two different categories, and my guess is that, um, well, we should make sure that we're understanding her correctly, but maybe go down the road more of the individual mood and the being hard on herself and turn to her daily mood log, to bring that to life more. What do you think, David?
Yeah, I see it as like two battles to be won here,
Mhm.
the individual and the interpersonal.
Exactly.
And they both have solutions and a lot of great things that can be done. But I think if we start with the daily mood log and the way you're criticizing yourself,
Yeah.
that would be a tremendous first step, all the
Yeah.
while acknowledging that there's still some relationships and husband and family issues that need to be dealt with in a skillful way.
Mhm. So, how does that sound to you, Haral? Can we maybe walk the audience through your daily mood log and have you look at your thoughts and feelings with us and kind of focus more on that aspect of it, the kind of self criticism and being hard on yourself?
yes.
Yeah. So
Let's do the daily mood log first, and then we can do the empathy
exactly.
grades.
I
Yeah.
agree. Yeah. Do you want to take the lead on that, David?
Yeah, but feel free to chime in. But
Let me just tell the audience to turn to page 4 in the handout packet. That is actually where you have Hiral's daily mood log. And without seeing her at all, we just asked her to think of a moment in time and put that at the top and circle the feelings that were coming up for her and write down the negative thoughts that she was having as she was feeling that. And this is kind of what she shared with us. So David, maybe you can walk us through it.
the upsetting moment, and we always try to focus on one moment because all of your problems will be embedded in any one moment when you're upset. And so we can use the daily mood log to understand what's going on, as well as to trigger some hopefully fairly profound changes. But my heart went out to you, Hiral, when I read this one, because we have a new baby in our family. My son and his wife have a beautiful little boy who's just 9 months old. But he came down. They live about an hour from here, and they brought him to have us babysit for a few hours while the two of them went to a spa and took a little break. And he had kind of a meltdown because mommy was gone, and he just screamed, and and it went on for a good hour and a half, and it was uncomfortable to try to figure out what to do or how to think about it. But you and your mother-in-law took your son for a vaccination, and this was on January 3rd, and he had a meltdown, and you were really affected by it, and you were feeling down and unhappy 100%, anxious 100%, guilty and ashamed 100%, inferior and defective 100%, lonely at 80, embarrassed and self-conscious 100, hopeless 100, frustrated 100, and annoyed and irritated 80%. And I just want to point out that, again, getting these measures is not a trivial thing at all, because if you went to the Stanford psychiatric inpatient unit and tested any of the patients there, they would not have scores higher than this. And that means that the distress that you were feeling at that time, and probably still feel a lot of the time, is so severe as to be almost hard for people to imagine, if they haven't experienced something similar. Does that make sense, Hiral?
Yeah,
That
it does.
it's really like being in an emotional hell. And then what are the thoughts that are triggering it? And number one, you were telling, and this is so eye-opening here, Hiral, speaks to your pain as well as what's really beautiful and awesome about you. You're telling yourself, I'm not a good mother, and that's 100%. And then you identified a bunch of distortions in that I'll ignore for the moment. But, all or nothing thinking is certainly a huge one for perfectionism. And then a should statement that often goes hand in hand with self-criticism and all or nothing thinking. I should be able to handle my son well. And you also believe that 100%. I'm failing as a mother 100%. And I will ruin my son's future if I'm unable to handle and nurture him well 100%. And then you added a few additional ones that I added to my daily mood log just by hand. And if you're watching, you can add to yours also. Number 5, I should always know everything. That was 80%. That's why you were feeling overwhelmed before we began. Put more pressure. The idea here for us to help you relax and be with you and support you, that you have to know everything and get it just right. And again, I felt sad seeing what pressure that you're on. And then my family will judge me if and blame me if I ever make any mistakes. And that's 100%. And I'm sure that triggers guilt and shame and anger and frustration and resentment as well. And that I should always be able to protect my son from any physical attack, like if another angry child were to attack him when they're playing, but also to protect him from any emotions. And can you think of any additional thoughts we've had since we started, Hiral or Jill, that we could add?
The only other one I captured what she said in the very beginning of our work just now, I shouldn't make any mistakes.
Yeah. And we didn't have that already.
No, I mean, you could say it's similar to I should always know everything, but it's not
Oh, I see.
exactly.
Yeah. That's a good one. I shouldn't make any mistakes. And when you tell yourself that, how believable is that, Hiral?
I think 80%.
80%. Okay, that's a powerful one. Yeah, I have a question for you, Jill, because I know from my own history, I struggled with a lot of perfectionism on multiple levels early in my career, Hiral. Um, but did you ever, Jill? Well, you did, yes. The first time we worked together, it was on perfectionism.
Yeah, absolutely. Which one did you want me to share? I mean, the first time that I ever did personal work with David in the early days of the Tuesday group back when we met in David's living room, I was sharing my being very hard on myself. I think the example was around clinical work, right, David?
Yeah.
Or yeah, I mean, I had struggled with it related to clinical work and patient care as well as parenting, but yeah, being very hard on myself and feeling not good enough and self-critical and perfectionistic. And then I also did another bout of personal work around parenting stuff where my son, who was, yeah, probably a similar age, maybe a little older, 6 or something, was being kind of mean to his brother, kind of went through a period of time where he was being mean to his brother. And I was honestly really worried that I wasn't doing a good enough job parenting him and he was going to end up being like a sociopath because he wasn't showing enough empathy to his younger brother when my older son was about 6 and his little brother was about 3. And I struggled with that a lot, thinking, what am I doing wrong that he's not being more empathic and kind to his brother? Yeah.
And
I said to David that when we were chatting right before this session, I said to David, I even had one of those thoughts this morning when my younger son, who's now 18, was talking about wanting to eat less because he wants to look super fit. And I started to worry in my mind if he would have an eating disorder, because I happen to be reading a book right now about eating disorders to help one of my patients. And so that was top of mind. And I thought, damn, what am I doing wrong that now my 18-year-old is obsessed with body image? And so I can really relate to so much of what you're sharing. And I suspect so many people in our audience can too.
and then a question for you, because this relates to you also, Hiral, is that the personal work that we're doing today has a double goal. One, of course, is to bring you some relief and joy, to make your life a lot more worth living, and to see if we can find a way to bring that about. But secondly, is we're trying to pave the way for really people to be develop really superb therapy skills. And now you, Jill, have developed teaching and therapy skills that far eclipse my own, and I'm proud to say that. But to what extent was your own personal work played a role in evolving to this amazing level that you're at today?
Yeah. the personal work that I've done with you and others over the years has been so impactful in my journey. And I think I've always felt that we have to practice what we preach, right? And so if I'm struggling with perfectionism, then I need to work on it. And I think doing my own personal work, as I hope is the case for you, Hiral, as well, it also kind of gave me so much of a deeper understanding of the model and how it works. Actually, David recalls sometimes, and this is a tangent, so I don't want to take up too much time, but there was a time early in, or I don't know how long ago, maybe 10 years ago or something, where I was doing some personal work with David and a group, and he kind of went from empathy, testing and empathy to methods, and we had a great session. And at the end, I said, "Oh man, I think you skipped agenda setting," and I felt a little I felt like I missed out on this opportunity to actually feel proud of my symptoms. And that was when David started to think, oh, maybe everyone can benefit from addressing resistance. And so, yeah, I mean, the bottom line is that doing personal work is not only incredibly helpful to us personally as human beings, but also so helpful in learning the model.
And the reason, I'm sure, is obvious, but a high percentage of the patients you treat in your career, Hiral, will also have this belief, I'm not good enough. And so your personal work will become as valuable as your training, sometimes more so. Uh, so, and anyway, should we get our empathy grades at this point?
Yeah, I think let's check in with you, Hiral, and ask you, and David, maybe you can ask those questions. But yeah, we've spent a good amount of time so far, maybe 40 minutes connecting with Hiral, going through her daily mood log and listening. And now we'll check in and ask Hiral how we're doing on empathy and figure out if we're ready to move forward.
Yeah, so well, if you could grade us in three areas, you can tell us, whatever you want to tell us too, but the first one would be thought empathy. And what that means is how accurately have Jill and David understood how you're thinking, your negative thoughts that are going through your mind. The second area is to what extent are we understanding your negative feelings, your depression, your anxiety, your guilt, your anger, your discouragement, your shame, your embarrassment, your loneliness? And then third is to what extent, this is the big one and maybe the toughest one in a sense, to what extent have David and Jill created a sense of warmth and trust and connection and acceptance that you feel accepted and cared about in a genuine way. So if you can grade us in those three areas.
Yeah, so I think for the first two, it's A. And for the last one, I don't know because I don't know how relevant I am for most of the people who are watching me because I the reason why I'm thinking this is because there are people who have like probably different kind of culture and family background and setup. So I don't know if what I'm speaking is making sense to them. So that is why I just feel I don't know. I mean, when the third thing comes,
The third question, though, was David, to what extent are you, Hiral, feeling a sense of acceptance from Jill and David, a sense of warmth? Isn't that right, David? It was
Yeah,
asking Hiral, to what extent do you feel like David and I are providing you with a feeling of warmth and empathy and trust?
or
yeah, I
maybe
think
you're
that
also thinking that we have a different family background, so maybe we're not able, just like the people in the audience. So tell us more about that.
yeah, I really feel when I talk about my family background or something like that, my family issues, I'm talking about some third world issues because there are so many other things that people might be facing or I think, yeah. So I just feel that, like these are very basic issues. Like nowadays, hardly anybody would be feeling, or this is what actually I feel in my mind. I'm not sure about anyone else in the audience.
So are you feeling maybe that we don't really get the fact that you're struggling with, like, say, family issues that are heavily woven into your culture, and maybe we won't get what you're saying and all the pressures on you, so that you're still feeling a little bit alone and lonely, even with David and Jill.
Yes,
Is that right?
yes.
Yeah. I wonder, David, I have a couple thoughts here, but Hiral, I wonder if it might be meaningful for you if I read a couple of things that people are saying in the chat around their feeling connected with you. And it's a unique situation, David, because it's not just you and I, but she's feeling like she's got this audience of people who maybe don't understand. Would it be useful for me to share that with Hiral?
That's a good thing, and I have a direction also. So
Okay. Do you want to tell me what you're thinking first, or you want me to share it?
yeah, well, what I'm thinking is that Hiral, you're keeping a lot inside all the time, even as though you're like a pressure, uh, and that I'm wondering if there are some times when you feel tearful, or even when you're talking to David and Jill, and feel like it would be awfully nice to let the defenses down, and let some feelings of sadness and loneliness flow, and share. You may not. This may be way off base, but that's kind of, and that's kind of similar to what you were thinking, Jill. Uh, does that make any sense?
Yeah. So even while I'm talking, I do feel like crying, but then I also, in the back of my mind, I feel this is not a real therapy session. So, I should not be talking too much, or, I don't want to take away too much time in speaking and, talking about my story. So, yeah.
So there are times that you're feeling like you'd really like to cry, and then you kind of tell yourself, maybe I'm not performing well enough, or I'm taking up too much time, or something of that nature. Can you tell us what you're thinking and feeling when you kind of want to cry here? Tell us what that's like, what you're thinking and feeling when you're feeling vulnerable and alone.
I think right now I want to be more productive.
Or just let those tears come. I have, Hiral, I have a virtual hug for you. That's bad therapeutic technique, because we're not allowed to touch a patient. But I'm just feeling really close to you right now when you're sharing those tears. And I'm grateful, for what you're doing. And then I felt sad when you're crying and saying, I want to be more productive. Uh, the you know yeah, I guess I want you to be a lot less productive and just be more like this. This is a beautiful side of you, to my way of thinking.
And there's no expectation of you not sharing your tears. To the contrary, we want this to feel as real as possible, right? This is not scripted. This is not therapy, but it is a real live, session, right? And so we want you to be able to be real and vulnerable, even though I can imagine that's actually really hard. You want to just share with us what's coming up for you now as you're feeling kind of more vulnerable or more emotional?
Yeah, so I think it just feels that, I don't want to do anything, no performance, and, uh, just sit aside and uh, just not think anything and just watch some good Netflix stuff and, just chill and not worry about the world, what the world is thinking, or what will happen if I'm not around my son or my family.
Yeah.
I just want to be by myself, not giving anything to anyone apart from myself.
You feel so burdened, it sounds like, right? By the thoughts and feelings, right? I mean, burdened to have to take care of your son, but truly what's feeling like such a burden is this kind of talk track that keeps saying you're not good enough, you need to be doing more, that's worrying about him. And you're feeling like, I just wish I could tune all of that out and watch Netflix and chill and not be thinking and worrying. Am I getting you right?
Yes,
And that's so resonate because you shared earlier that you do feel so tired and overwhelmed by constantly beating yourself up and measuring yourself against others and worrying that you're not doing enough, right? And so I hear you saying, I really want to be able to tune that out and just kind of be present and not feel so burdened. Am I getting you right?
yes,
Yeah, and I just wanna say I think that's so unbelievably relatable for so many people, whatever the context, to feel like it's their mind that's their own worst enemy, and that if they could just kinda turn it off and be in the moment and relax and enjoy, that's the bliss that they're after. I think that's so unbelievably relatable, actually. Mm, David, I also wanted to share with her all because I do think it's um it's fair because you're really putting yourself out on a limb here, just that so many people, when you said you were worried that this is some other unique kind of problem that people couldn't relate to, just the chat box, which I don't want you and David focusing on because it's very distracting and I'm going to close it as well. But the chat box is basically saying this is very relevant, what you're sharing about your life, your challenges with your in laws, your husband, the demands of life. So many people saying, I relate to the psychological pressure from in laws and self criticism and, despite the cultural differences, most moms can understand difficult family dynamics that make us feel unheard, unseen, and alone. So many people saying what you're describing is so relatable, so human, and also that they're so honored that you're being so open and vulnerable. So I won't go on and on, but we got lots of messages in the chat, just saying that people are feeling so connected to you and so honored to hear your story.
How are you feeling right now, Hiral? You kind of opened up a little bit and seem a little quiet. I'd just love to hear what you're feeling and thinking right now.
thinking after hearing that chat, I think I'm being more productive. That's what I'm thinking. I'm sorry, but
Yeah,
I can't,
yeah,
unwire myself. I mean,
yeah, yeah.
easy. Yeah.
Right,
That's beautiful because you really
right.
are. Yeah, you gave us a huge gift here,
Right, right.
and you've made the biggest contribution so far to the workshop. Yeah. By the
Yeah.
way, you watch Netflix? You like to watch Netflix on television by yourself?
Yeah.
Don't you think that's kind of shameful?
No, it's not.
I used to have a rule, I guess I still do, that because there's so much anti-television propaganda all the time. And so my position is every human being needs to watch 20 hours of television per week to maintain mental health. And it's certainly a rule that I follow.
It was actually my New Year's resolution to try to watch more TV this year. So I'm not actually kidding. So to just, as you said, create time to chill. Right. And so, yes, again, very relatable. Right. Very
Yeah.
relatable.
I also want you to know, Pharrell, that what you did just now and kind of sharing those feelings and letting the tears flow, I'll never forget that, Hiral. And if we were in the same orbit, like, like if you were here in the United States and attending the Tuesday group and stuff, every time I would see you in person, would see that Hiral and feel close to you.
Uh, I think the reason why I'm not able to open up so much is because, uh, like, nobody's cared so much. So, I mean, nobody bothers. Nobody is like really willing to understand how I'm feeling. I mean, I'm almost invisible and unheard. So it's so when you guys are, paying so much of attention on my feelings and everything, it's like, I'm not in it. The voice inside me is just saying, no, 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 you're not important. So, don't, they're
Yeah,
not connecting with you. Like, they're just
yeah,
doing their part. So it's so hard to even believe that, somebody can care for you so much because I'm so
yeah,
used to being unheard and unseen and feeling so unimportant in my own life.
yeah. That it's really hard for you to accept that somebody could care about you.
Yeah.
It doesn't
Yeah.
seem believable.
Yes. Mm.
Yeah, right. Well, I think that's the most important thing that you've said, and I sensed that about you within 15 seconds of meeting you earlier before the workshop began, and I didn't feel close to you, and it was very troubling to me. And I I thought about these things at that time, and how this getting locked up in and not believing anyone could care about you is another huge dimension of it that keeps you kind of trapped and unhappy. Uh,
Yeah.
the
Hmm.
that voice. How are you feeling right now in terms of the letter grade on the acceptance?
Yeah, I think I think now I'm really ready to accept that. Yeah, I mean, there is some connection being formed. I mean, I really want to believe. So I think I've moved towards 80%. I would not,
Oh,
I'll
okay.
not be able
So
to grade, but yeah.
yeah, yeah, yeah. That's great. Thank you for that. Let me ask you this question now. Suppose that this was a very good experience for you here, I guess tonight. It's tonight in your part of the world there. And at the end, you had the thought, wow, that session with David and Jill was really kind of life changing. What would happen? What would you be hoping for by the end of today's session?
I think I just hope to feel more relaxed and just feel comfortable in my own skin.
Okay, great. And then I'm wondering, Jill, if this might be a good time to take that 5 minute bathroom break for folks, and then when we come back, and 5 minutes or so, or should we give people 10 minutes?
Yeah. Yeah, I think what we'll say is you've seen us do testing with a brief mood survey. You've seen us do empathy, and David just asked something we call the miracle cure question, which kind of starts to lead us in the direction of agenda setting or assessment of resistance. What miracle? What is Hiral looking for help with? And that's to feel more relaxed and comfortable in her own skin. And so we're gonna do we'll do a pause so that everybody can go to the bathroom, stretch their legs. And it's kind of easy to give everyone a 10-minute break, which means we'll start up again exactly at 11 a.m. Pacific, and then we're going to move forward with the rest of the model. So do not log off or anything like that. Anyone, just stay on and use the restroom if you need to. Okay, David, you're back with us, so just unmute yourself.
How are you doing, Hiral?
Yeah, I think I'm just trying to accept all the love and warmth, which I'm not used to. So I was just,
Well, hopefully it will evolve. But yeah, that's one of our a goal that's kind of emerged since we started working together, and we're going to stick with our original goal of helping you with this self-critical voice in your brain. But I'll also be having my eye on that interpersonal dimension. And as a teaching point, I don't know how many therapists would have measured, an A, what's the letter grade on warmth and acceptance? I think not one therapist in 1,000 would do that. And yet it was crucial. You didn't want to criticize us. And yet it was necessary to bring that out. And it's impossible to get close if you haven't acknowledged, I'm not feeling close. I want to feel close to you, but I can't. And what's going on with you, and letting you be real. And that's an unfolding process over time. And that's a beautiful thing. And I thought the way you handled that was really, gentle and beautiful, and I appreciated you greatly. Although it might be hard for you to accept or believe that, or to experience that, but I think that loneliness that you have is very, very powerful, and very major component, but will help you get over your loneliness with yourself today as a kind of a first step. Get into maybe a little bit of self-love.
And if I could, oh, go ahead. Did you want to say something?
no, I'm just saying, hopefully, fingers crossed.
Right. And I wanted to say one other thing of a teaching point that I think is important, which is so many times when we're connecting with our patients in the outset of therapy, but it could really be at any point in therapy, and the patient will share many different things with us. And part of the art of doing effective therapy is also focusing sessions and trying to figure out what direction to go in. And so I wanted to just articulate that, with what Hiral shared with us, there's really at least two potential directions we could go in. And one is this direction that we've decided to go in large part also based on what you're asking for help with, which is I want to feel less anxious. I want to feel calm. I want to feel at peace with myself. And so that means we're going to work on her daily mood log and your negative thoughts and your perfectionism and, anxiety about your son. But surely there's a whole other direction we could go in, and that you could go in the future in therapy or personal work around your relationship with others, right? And around not feeling close and not feeling important. And there's kind of a whole other relationship piece that we could conceptualize and work on. And so I only say that to say we recognize, as therapists, that there's always many roads we could walk down, and we in Team CBT kind of pick one for today and say, let's make some really good progress in this one area, knowing a different day we could work on a different sort of conceptualization. So with that in mind, we should move forward, right, David?
Yeah. And one last teaching point is that they were failing with you on the warmth and acceptance, although we're being partially successful. But that failure is the greatest success so far in the session. Because it's so critically important. And the problem isn't the failure, but the shame or the judgment. But the failure that's happening is very exciting and very desirable. Does that make any sense? It probably sounds like bullshit from an elderly, demented, babbling man. But does it make any sense?
Yeah, so I'm just wondering, I'm just confused right now. Why do you say that it's so precious? I mean, because you're failing right now. We want to be connected so that we can move ahead, right? So how does this failure make sense?
Yeah, well, we're going to move ahead, and regardless, and probably the connections will continue to evolve, but that the working with you without bringing that failure to conscious awareness would make the therapy very superficial.
Right.
Yeah,
Yeah,
it's not that we must fail, but that if we are failing, recognizing that we're failing and bringing it to conscious awareness gives us an opportunity
Yeah.
to correct and to
Yeah. See, the
right?
goal of TEAM is to fail at T and E and A and M, to fail at every level. That's what we're hoping for. Because every time you fail, that's your chance to go deeper. And I was just trying to make that point. Uh, um, but anyway, let's push
Yeah.
ahead here. You said that your goal was to feel more. You hope to feel more relaxed without all that chatter going on in your brain and the self-criticism by the end of the demonstration. And let's imagine, Hiral, that we have a big red magic button. And if you press that magic button, you'll instantly become joyful and relaxed with no effort at all. And all those negative thoughts and feelings will instantly disappear. And your dream will have come true instantly. And so you'll walk out of here just feeling incredibly happy and relaxed. Would you press that magic button?
Yes, for sure.
For sure. Yeah, I'm glad that you said that. That's what everyone says. Well, we don't have a magic button, Hiral, but we do have magical techniques. And I have no doubt if we work together, we can and will bring that result about. But I don't think it would be such a good idea.
Why?
Why? Well, because there might be some really beautiful and awesome things that are hiding within all these self-critical thoughts and feelings. And maybe we should list some of them before we get too cute about making them all suddenly disappear. Would you be willing to take a few minutes and take a look at some of them?
Yes.
And you might want to make a list of positives, but in the handout, don't we have a place
Page
where
6 of your handout packet is a blank positive reframing table. And so Hiral, you and the whole audience can follow along as well, and we can all be writing this down together.
Yeah, and it's on page 6 of the handout. If you have that, Hiral, I've got mine here. And in the left column, we're going to select thought or feeling. And you gave us 8 or 9, maybe even 10, I don't remember, negative thoughts and at least 9 negative feelings, all very intense. And if you like, you can just choose any one of them to get us started that you'd like to take a look and see what some of the positives are. And there's 2 questions, Hiral, that we're going to ask about each negative thought or feeling that you bring up. One is, what are some advantages or benefits to you of having this negative thought or feeling? Like when you tell
Okay.
yourself, let's see,
I'm not a good mother.
yeah, I'm not a good mother, or I'm failing as a mother. How does that help you? That's number one. And then number two, what does that thought or feeling show about you and your core values as a human being that's positive, beautiful, and awesome?
Okay.
Those are the two things. What are the advantages to me, and what does it show about me? So if you'll choose any negative thought or feeling that interests you, we can see what we can come up with.
I think I'll choose this one. My family will judge me and blame me if I make a mistake.
Okay, so let's write that in the left-hand column. Thought number one: my family will will
Judge me
judge
and
me,
blame me if I
judge
make a
me,
mistake.
yeah, and blame me um, if I make a mistake. And so let's look at these two questions, and then we can write the answers in the right-hand column. And then if you run out of paper, I have I just use a clipboard with extra paper, and just so we have it's important to record these things on paper. But number one, what are some advantages or benefits of telling yourself that my family will judge me and blame me if I make a mistake? How will that thought help you?
I think it will make me more cautious towards my own actions. I
Okay,
mean,
would you write that down? Makes me more cautious. Uh, yeah, toward toward my own actions. Is that true?
yeah,
Is that powerful?
yeah, it is.
Is that important?
Yeah, it is.
Yeah, great, beautiful. What are some other advantages or benefits of that? Or to ask the other question, what does that show about you and your core values as a human being?
I think it also helps me to slow down a little. I mean, when I'm being cautious, I can really slow down a little.
Well,
Mm.
write that down. I love that as number two on the list of positives. Helps me slow
Slow
down
down.
a little. Is that also important?
Yes,
Is that powerful?
yes, it is.
Is that real?
Yes.
Yeah, beautiful. What else does this thought show about you and your core values as a human being that's positive?
Uh, it also helps me to prioritize and focus on um, quality rather than quantity. I mean, rather than doing too many things at a time, it helps
Okay,
me to prioritize.
put that down.
Yeah.
Helps me focus on quality versus quantity. That's a good one. I love that. Can you
And what
think?
is it? Yeah, David asked you
Go
too
ahead.
to think about what does it show about you and your value system? I can think of lots of things that I want you to think about it when you tell yourself, my family will judge me and blame me if I make a mistake. What does it actually show about you and what you value? What's important to you?
And just as an aside for
I
a
think
teaching point, if it's hard for the patient to see it at first, you're in really good shape because that when it comes, it will be like a new brain circuits getting fired up.
What were you going to say, Hiral?
Yeah. So I think what it really shows is that I value having a good life, uh, a value creating life where, I'm just not doing anything randomly or just because, others are doing it, but I'm doing it because it makes a lot of sense to me.
So I value a good life. Is that what you said?
Yeah.
Uh-huh. Right,
Good
right.
and meaningful, good and meaningful life.
Yes. Uh-huh. I like that. And meaningful, good and meaningful.
Right. You also said like it's something about you said like being thoughtful, and I wonder if some of the values are in there. Like it shows that I'm conscientious, right? There's something about you said like I slow down, I'm thoughtful, quality over quantity. So would that be accurate to say it when you're worried about your family judging you and blaming you and worried about making a mistake? It shows that you're extremely conscientious and thoughtful and thorough.
Yes.
Is that true?
Yes.
You have high standards.
Yes. I think
Let's
those are
add
creating problems for me.
that. So we've added two more. The first is that I value a good and meaningful life, and that I have high standards. Um, there's another really important one. Um, you are you saying in that thought, my family will judge me and blame me if I make a mistake? That's a negative. And what is the positive that you'd be hoping for from the family?
I think to just accept me and let me be.
Mhm.
Is that true that you want acceptance from your
Yes.
family?
Yes.
Well, put that down that I want acceptance.
Well, it shows that I value acceptance, right? Like that's the direction I was thinking as well, David. When I tell myself my family will judge me and blame me if I make a mistake, it's really showing that it's supremely important to me to get my family's love and approval and acceptance. Is that
Yeah.
is that true?
Yeah. That's true.
So that's
Yeah.
two. One is I value acceptance, and that I also that I want love and closeness with the family. Is that true?
Yes.
Yeah.
Mhm.
Okay. Now, let me just ask about these last few that we've put down here. That I want love and closeness with the family. Is that real?
Yeah.
Is that powerful?
Yes.
Is that important?
Yes, it is.
Yeah, and would the same be true of acceptance?
Yes.
Uh-huh. And would the same be true of high standards? Are my high standards real?
Yeah, they are real, but they're causing a lot of problem for me.
Oh yeah, we're
Yeah.
only looking at the positive side here, but we can look at the negative side because all of these things have a dark underbelly as well.
Yeah.
You know, your high standards, have there been any positives associated with your high standards?
Yeah, I think because of my high standards or because of my high values, people are easily able to connect with me. Though, it's like
Oh
it's just
yeah.
me who's being giving, but they are someone who feel that they can confide in me, or like they feel that we can always go to her. So
Mm.
Yeah. So add that to your list. It's easy to connect with me. Uh, So that's quite an impressive list you got from that first thought. Do you want to try another thought or an emotion?
yeah, I think thought.
Mhm.
A thought, yeah, the thoughts are make them more unique to you. And
Yeah.
lately we've trended more toward positive reframing of thoughts than feelings, although both are
Yeah.
powerful and easy tools. Give us another thought.
So I like to choose I'm failing as a mother.
Okay, write that down. I'm failing as a mother. Like when my child has an implosion, an explosion. And what are some advantages and benefits of that thought? How is that thought helpful to you?
I think it encourages me to do better as a mother.
Yeah, write that down. It encourages me uh, to do better as a mother. Is that true?
Yeah, because the only reason why I'm sitting here is for my son, that, I really want to give him the best version of me. So that is why I've decided to, volunteer. So yeah,
Can we add that
definitely.
as a second one? It shows I want to give my son the best version of myself. And could and once and by the same token, is that then a reflection of my love for my son?
Yeah.
Would you add that? Shows
Yes.
how much I love my son.
And again, of course, it shows your high standards, right, Hiral? That, if I observe him doing something suboptimal and I'm telling myself I'm failing as a mother, that I have really high standards for myself, right? I need to be the perfect mother. Is that true?
Yes.
Yeah.
Yeah, so I'm failing as a mother so far. It encourages me to be a better mother, to learn and grow. It shows that I want to give the best version of myself to my son. By the same token, it shows my great love for my son, and it's also an expression of my high standards. And are these things we wrote down, are these true?
Yes.
Are they powerful?
Yes.
Are they important?
Yeah, very much.
Yeah, that's awesome. You want to try another thought or feeling?
Um, I should be able to handle my son well.
Okay, put that one down. Should be able to handle my son better. Did I get
Yeah.
that right?
Yes.
And then what are some advantages of that thought? Would these be similar to the previous thought?
I think it helps me to keep exploring more and more, or keep trying new things, which is something that I love doing and I don't get to do, considering the kind of a setup I am in right now. So it's like the challenges he throws on me is really, um, yeah, it also, um, yeah, it helps me evolve also, I think,
Yeah,
as a
yeah,
human
Yeah.
being.
yeah. It helps me explore more and more. It helps me evolve. I love that.
Yeah, I saw you actually kind of light up when you said that. Like, there is definitely something about learning how to be a better parent that's really appealing to you, right? And
Um,
exploring more and learning more. And then at the same time, sometimes you feel a little stuck and unable to try new things because of your environment. But it definitely speaks to your desire to want to learn and grow.
yeah, yeah, I think, yeah, he's he's the biggest source. I mean, the way he throws the challenges on me. So I think because of him, I've learned so many other things which I'm not like acknowledging, or yeah. I've learned so much.
Well, let's add that. I've learned so much. Well, that's awesome. Or is there another thought or feeling you'd like to do this with?
I think I should know everything.
Oh, okay. Put that down. I should know everything. And then what are some advantages of that? Some benefits of that? I can think of one, by the way.
Yeah, please tell me.
Advan Well, uh, let's say we had some woman here who's pretty average, and she's a mother. Would you expect her to know everything?
No.
So the fact that you expect yourself to know everything, doesn't that show then that you must be this incredibly brilliant person? It gives an image of yourself as being, way better, a cut above.
Yes.
Can we put that down as number one? Shows I'm, super intelligent.
Yeah.
And what are some other advantages of that, or what does it show about you that's positive and awesome?
I think which also means that when it comes to parenting, I'm not behind any other mother, or it's not about behind. I mean, I'm just, I'm just doing good, and I'm just
Yeah,
open to receiving
Mm.
lot new things from my environment.
yeah, I'm not behind, and it shows I'm learning constantly. I think that's what you said,
Yeah,
absorbing things.
yeah, yeah. I'm open to learning things.
I have one other thought here. It probably relates to so many of the things, but definitely this one. I should know everything. Hiral, did this reveal you to be an arrogant know-it-all, or does it reveal you to be kind of a humble person who's always wanting to, see her own flaws and improve as a person?
Yeah, I think it means improve as a person also, and also someone who can always have something to give to when someone is coming for help. So
Mm.
yeah, I think both.
Yeah. So it shows me as a very giving person. We got the wanting to learn and grow, but I was also kind of sneaking in there this idea that shows that you're very humble.
Yeah,
Because you're not walking around thinking I know it all. Let me tell you how to
yeah,
be the best parent ever, but rather you're like, oh, how can I do better? And that shows you to be pretty humble. Do you agree?
yeah, yeah.
Is that true?
Yes,
Is
Yeah.
that a part of your value system, humility?
yes, it is.
Is that powerful?
Yeah, very.
Is that real?
Yes.
Yeah, beautiful. Well, I'm running out of paper here.
Yeah.
Uh,
Yeah, my only thinking, I do think we might be ready to move on. The only question I had is maybe it would be helpful. We could do, since anxiety is her strongest, we could just do some positive reframing of that, or guilt or shame. One of the emotions maybe as a change, or we can just move forward, David.
Well, would there be a one of your negative emotions from your daily mood log that we could do some positive reframing, because you had 100 on depressed,
Most of
anxious,
them.
ashamed, and
Yeah.
inferior and inadequate, and embarrassed and hopeless and frustrated, and then you had 80% on lonely and 80% on angry, irritated, upset. Would there be one of those that you'd like to do some positive reframing on?
I would like to do from my DMN, I would like to choose the guilt one.
Yeah.
Guilt.
The guilt. Okay,
Yeah.
put the
Yeah.
guilt down. And what does that show? What are some advantages of your guilt, and what does it show about you that's positive and awesome? Oh, I just thought of some.
Okay, so I think uh, my feelings of guilt uh, always reminds me to um, like behave. I mean, behave well, or become a
Okay.
better person, or be good to others.
Yeah, put that down. Reminds me to be good to others. I love that. Does that seem real?
Yeah.
Is that important?
Yes, it is.
Powerful? Yeah.
Yes.
I had another one. Does your guilt show that you're, honest and willing to examine your
Yeah.
own role? Well,
Yes.
then put that down. And does it show as well that you're willing to be accountable rather than just blaming everyone
Yeah.
else? Is that important?
100%.
Yeah,
Yes.
put that down. Any other feeling that you'd like to take a look at?
I think hopelessness.
Oh yeah, that's a good one. That was one of the hardest ones for me to figure out when I first. It was the second hardest actually when I created positive reframing. What are some really wonderful things about hopelessness? Aaron Beck said it's the worst emotion of all. But what are some beautiful things about hopelessness? And how does it help you? And what does it show about you that's positive and awesome?
I think it always uh, makes me feel grounded or aware of the reality.
Oh yeah, realistic and grounded. Uh-huh. Because there are things going on in the environment right now which are undesirable,
Yeah.
as well as within yourself.
Yes.
So, does that seem real,
Yes.
powerful,
Yes.
important?
Yes.
What are some other tremendous advantages of feeling hopeless? Can you think of any way that protects you
I
or
think
helps you?
no. I think it helps me to move on. Actually, to not just like it helps me to not give up. Actually, I don't know. It's so
Mhm.
contradicting, but yeah, it
Yeah,
motivates me to just do something about it. I mean, just not.
yeah,
Yeah.
yeah. Do something. Right.
Yeah. To be productive, to be proactive, to try something new.
Yeah.
Yeah. Uh, does it also, I don't know, for me, being hopeless would sort of protects me from trying and getting disappointed.
Also, um, it protects me from boredom. Actually,
Oh,
because
It
I'm not
protects me
someone.
from,
from boredom.
protects from boredom. Yeah, that's
Hmm.
a good one.
David, I think we should, based on time.
Yeah,
We're
we've
going to
got to
run out
push
of time and not have
ahead.
time for methods if we don't move forward.
Yeah,
Yeah.
yeah. So yeah, that's right. So you've given us. Well, I've got 2, 4, 5, 6, 7, 8, uh, uh, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 30 positives and these negative thoughts and feelings. And the thing is that if you press that magic button, and all your negative thoughts and feelings disappear. All these positives will go down the toilet right along with your negative thoughts and feelings. Why in the world would you want to do that?
Because I'm not able to live in the present moment. And it has become so difficult for me to see things the way they are. I mean, little small things, and I get triggered, and I feel, oh, what if my son ends up being uh, like always rude or whatever, whatever. So I just don't want to live in the future. I want to live in the present moment and just take
Okay.
each day at a time.
Well, that's a beautiful, powerful argument. If you'll turn to your daily mood log on page 4, I have a suggestion. Could we think in terms not of pressing a magic button and making all of these completely disappear? Because there is a lot of value in your negative thoughts and feelings. They show really tremendous things about you that we don't want to get rid of. And maybe we can have it both ways by thinking about a magic dial instead. Like you're down and unhappy 100%. Would be there? What would be a percentage that you might be willing to lower that down to by the end of our demonstration, where you would be feeling a lot less pain, but you would still maybe keep some of that down feeling, because there are things to feel a little down about, and but you'd preserve all those beautiful qualities about yourself. What would be a good goal for the feeling down at the end of the demonstration?
I think 20%.
Yeah, 20. Okay, put a 20 in the goal column. Now, is that high enough for you? Is that
No, I
enough?
think 20. Yeah, 20 is fine.
Okay. And then how much? So I've got written 20 in the goal column. We can't show this on the screen because we don't know how to type and have it appear on the screen. But how anxious, worried, nervous, and frightened would you like to feel by the end of the demonstration? That was 100%. What would be a healthy amount?
That's 5%.
5. Okay, put a 5 down. Beautiful. How guilty, bad, and ashamed would you like to feel? Was 100.
Yeah, I think 5, not more than
5.
that.
Okay, I love these 5s. Um, how inferior, inadequate, and defective? That was 100, like overwhelmingly high. What's a good amount of defectiveness for tonight?
I think 10%.
10. Okay, great. And then how lonely do you wish to feel? That was 80.
I don't want to feel lonely at all.
Put a 0 there. Um, how embarrassed and self-conscious would you like to feel?
0.
Okay, put a 0 there. That was 100. How hopeless do you want to feel?
I think 10%.
10. Okay, great. Put a 10 on the hopeless in the goal column. How frustrated? That was 100. What's a healthy amount
Yeah,
of
I think,
frustration?
no, I don't want to feel frustrated at all. I mean,
That's a
I
0.
took too much. Yeah,
0. Okay. And then how about annoyed, irritated, upset?
0.
A 0 all the way. You don't even want 5.
No, I've been upset for a quite long time now. I'm done
Okay.
being upset.
Okay. Beautiful. Now let's see if we can bring about some change, some of these changes. And if you could select one of your negative thoughts, you had the 4 original ones, and then we had at least 4 additional ones. So there's like I shouldn't make any mistakes was number 8, and I should always know everything. And is there one of those thoughts you might like to work on first? Because they'll all be perfect for our purpose.
So can I work on? I should always protect my son from being emotionally and physically harmed.
Okay,
Is that okay?
that's number 7. I should
Yeah.
always protect my son from physical or emotional uh, suffering. And then, are there any distortions in that thought?
I think all or none thinking, because I'm saying always. So
Yeah. And then it's not only all or nothing, but maybe overgeneralization.
yeah,
Both.
yes, yeah. Overgeneralization actually.
Yeah. What else?
So there's this should statement also that, I should be protecting my son all the time. Yeah.
Yeah.
Should statement.
Perfect. Put should in the distortion column, and I use abbreviations, but I forgot to add them to the checklist of cognitive distortions. But I use like sh for should or og for overgeneralization. Any others that you see?
I think I'm not sure, but emotional reasoning that, I constantly feel that, my son is not safe and I have to protect him.
Oh yeah, I love that emotional reasoning.
What about self-blame?
Yeah. That if I'm not around him, he might he might end up getting hurt, or he'll not be safe. So,
Would that be fortune telling?
yeah, actually, fortune telling. Hmm.
I thought of another one, like discounting the positive. Have
Yeah.
you ever protected your son so far?
Yes.
So
But yeah, I'm also discounting the positives that when he's around his friends, he feels so happy because
oh
he
yeah,
usually.
I love that. Yeah,
Mm.
put that down.
Right. Like you're discounting the positive of the situation. Like even if his
Yeah.
friend pushed him and he got hurt, he might still choose to have a play date, right? Even if
Yeah.
even if he feels a little sad, he might still have had a wonderful day. So there's some
Yeah.
discounting the positive. Part of all or nothing too. Yeah.
Yeah,
When I said self-blame, the specifics that I meant was to say, like, if I wasn't there and my son got pushed by a friend, I'm still blaming myself for not having
Yeah.
protected him. So that was that self-blame
Yes.
is blaming yourself for something you weren't entirely responsible for.
Yeah.
Yeah.
Oh, okay. Now, the there might be a couple other distortions too, but you've got a great list here. It's all or nothing was your very first one, and then overgeneralization, and then should statements, and discounting the positive, emotional reasoning, self-blame, fortune telling. Quite a few distortions. Now, how can you think of any way to talk back to that thought? Something you could tell yourself instead of I should always protect my son.
Yeah, I think mm, he's not my only responsibility. I mean, my husband and my family members, they are also equally accountable and responsible for his well-being. So I just don't have to take the entire burden of his well-being on my shoulders.
And how much do you believe what you just said? From zero
A
to 100.
100%.
Okay, write that in the right-hand column. The whole family is responsible. It's not all on my shoulders. I think isn't that what you said?
Mhm.
Yes.
Yeah. And and then if that's 100% true, then does that lower your belief? I should always protect my son.
Yeah, but it comes down to only 50%.
Mhm.
Okay, dude. Well, that's good. Put a line through the 100, and put a 50 right under it in that percent now column. And would you like to lower it down further?
Yeah, definitely.
Oh, okay. Um, I'll put it over in your camp here, Jill.
Well, I think that clearly the goal would be to move to methods, right? We tried one method, which is identify and explain the distortions, and the straightforward technique. We could call that two methods, right? So I think we just need
You
to
move
decide.
quickly to move it from 100 to 50%. So you're moving really fast.
Yeah, it just in sort of that straightforward technique, right? But the question we come up with now is what method should we move to next, right? So we could move in the direction of externalization of voices, for example, or we could do the double standard technique, which is more of they're both cognitive therapy role playing techniques, but one is a little more compassion based and one is a little more maybe direct. So
Aggressive.
aggressive, sure. So should we ask Hiral which she prefers? Either one
Yep.
I think could be effective. We're asking Hiral. We wouldn't necessarily ask our patients. I mean, we could ask, do you prefer a more gentle, compassion-based method or a more aggressive method? But also we know Hiral knows some of these methods. So what would you like to do, Hiral?
I think externalization of voices.
Okay,
Great.
awesome.
You want to
Let's
set it up, Jill?
Sure. Yeah. So we're going to try this method that's called externalization of voices, and I'll set it up slightly so the audience knows what we're doing here, right? So, Hiral, we're going to do kind of a role playing method here where you and I are going to play two parts of yourself. And in this case, I'm going to play kind of negative or self critical Hiral, and I'm going to kind of hit you with your negative thought. I should always protect my son from physical and emotional harm. And then I'm going to have you play the role of your kind of positive or rational thought. I'm going to have you kind of argue back against this self-critical thought. And um, you can use you can use any kind of response and be as creative as you want. But a couple of ideas for you is that you can kind of talk back to the negative thought using what we call self-defense, argue with it and poke holes in it and disagree with it. You can argue back with some self-acceptance and humility and agree with aspects of the negative thought or even combine the two. And then last, there's another method that's called the counterattack technique, where you can just kind of take issue with the fact that your mind keeps bullying you in this way and bully the bully. That's kind of what we say. And you can do any combination of the three. And what we'll do is we'll give you a chance to respond in the positive thought, and then we'll stop and see how you're doing. And if you need a role play for David or I to model a response, we'll just keep practicing back and forth till we can really crush this negative thought that's been plaguing you so much. How does that sound?
Good.
Okay.
Exciting.
All right. So who am I?
You are the negative voice of Hiral.
I am negative Hiral. Oh, yes, Hiral. And you are?
The positive Hiral. Yeah.
Exactly. Perfect. So yes, you know, Hiral, I just wanted to remind you that you should always protect your son from physical and emotional harm. You must be perfect in that regard.
Yeah, I think he's dependent on me. So true. But at the same time, I also have to teach him and also teach him certain ways of protecting himself also, because I'm not going to be there with him all the time. So yeah, I mean, there's no way I can always protect him and always be with him so that he is safe and sound.
Mm. And who won that? Was that you or me?
It was me.
And was that big or small?
Yeah, I think it was big.
Was it big or huge?
I'm really confused. I mean, it was big. I don't think it was huge.
Okay, wonderful. So this is a good start. The big, not huge. And so did you want to do a role reversal, or did you want to try it again, or did you want to hit David or me with it?
Yeah, I think I can do it with David.
Okay.
Okay.
And
I'll be the positive and you can be the negative and sock it to me.
yeah.
Negative
So,
self.
Okay.
I've just
Okay.
been waiting
so
for
Dave,
you to
just
take
for
us
the
through.
audience, Hiral is going to hit David with this negative thought in the you version, just like I did. And David playing the role of positive Hiral. So he's going to respond in the I version, in the voice of the positive Hiral. Go for it.
Yeah. So, you know what, Hiral, you should always protect your son from being harmed in whatever ways, emotional or physical. It's your job.
Yeah. Well, that's a wonderful, loving thought for sure, and I certainly always want to protect my son at every opportunity that I'd have. Um, I can't protect him uh, at every moment for the rest of his life, and I'll also be wanting to teach him how to protect himself emotionally and physically. But there is so that's not the threat. I think I'm doing a good job there, but there is a threat that I do need to protect him and myself from. It's a bigger threat.
What is that?
That's your bullshit. Constantly peppering me in my ear, putting me down, telling me I'm in danger, telling me I'm not good enough. And that unhappiness actually makes it harder for me to give him the kind of love that he wants. So you can take a hike, and as the Buddha said, uh, as well as great Indian teachers from 4,000 years ago, stick it where the sun don't shine.
Who won in that exchange? Was that the negative or the positive?
I think the positive.
Was that big or small?
It was big. It was huge.
It was huge.
Yeah.
Okay, and what
Uh,
David? Do you know how David won huge? Hiral?
Yeah. Yeah, I think the last piece of information where he's saying that, it's just your thoughts and you like, you just shut up and you just focus on what you're doing. Just keep loving your son and just acknowledge the fact that you're doing a good job. So that
yeah,
is
that's
something
great.
that
Let's see if you can do it. Are you ready?
I,
Who do you want to
okay.
attack you? Who's the most brutal opponent?
You.
Okay. Okay. Could I talk to you for a minute, Hiral?
Yeah.
I know that Jill and David were fooling you just now to give up on those self-critical thoughts. But I'm going to tell you the way it really is, Hiral, and you can't deny this without getting involved in a lot of self-deception. And that's that you should always protect your son from physical and emotional danger. And that's just a fact of the universe. That's a mother's job. And you better do that too.
Yeah, I think I'm already doing my job when he's in front of me, or I'm probably teaching him the best things and like probably teaching him the best values also. So I don't think there's anything else that I can teach him. Um, and also, I think the biggest important thing is for him to learn and grow. It's also important that he falls, he fails, and he learns things on his own because he's someone like me. He would want to always explore and experiment and learn. So I think I'll have to let him be the way I want my parents to let me be. So yeah,
Okay, so who won that?
yeah, me.
Big
I
or
did
small?
not see this coming. Big,
Big or huge?
huge.
Huge. And how did you get to huge?
I think the part where I said that I should just let him be and just let him learn certain things rather than just me teaching him and me taking the burden and pressure of taking
Yeah,
care of him.
yeah. What's the best thing that he can learn from his mother? The one thing.
I think just just loving herself and just taking
Is
care
it
of
a
her
she
own
or a
needs.
he?
Sorry,
Your child. It's a he or a she?
it's he. It's he.
He. Yeah.
So yeah. So I would want him to learn self love.
Self-love. And so is the best way to learn self-love to learn how to turn off that negative voice in your head?
Yeah.
And so in order to teach him self-love, that I would have to teach myself self-love.
Yeah.
And so the best thing I can do for him is to turn off that voice in my own head. Is that what you're saying?
Yes.
heal myself, and that's my best way of healing my son.
Yes.
Okay, do you want to jump to another? You
I
want
just
us to
wanted
hit
to
you
say
with?
I love what you said, Hiral. And part of why it's cool is David won using the counterattack technique, but you actually won with something else, right?
That's right.
Yeah.
And that's really cool too. But it's sort of one in the same. David was more aggressively saying, "I don't need to listen to your bullshit," and you're really saying the same thing, though, right? The best thing that I can
Yeah.
do for my son is let him be and sort of trust him and show him love and
Yeah.
show myself love and stop with the incessant self criticism. So anyway, just I thought that was really beautiful. But
Right.
David, you were asking, is there
I was going
another
to say,
thought?
can we see if we can mow down some more of your negative thoughts using externalization of voices now that you're on a roll?
Yeah.
And I'll be the negative, and then Jill can be the negative. We'll take turns. And can I
Mm.
just start at the top of your list?
Yeah. Okay.
Could I talk to you for a minute, Hiral?
Yeah.
I know you beat down, that ogre David on that last thought about your son. But there's one here that I'm going to hit you with now that you will not be able to argue with or defend yourself because it's just a truth of the universe, and that's that you're just not a good mother.
Um, I agree. At times I am not. I am at my worst, but also a lot of times I do things that makes him feel loved, and I think it also teaches him that he can very much uh, have two different feelings. I mean, he's like I'm teaching him to be okay with the fact that you can, be the good version of yourself and also the best version, rather than just focusing on being good, and rather than just trying to please everybody else and like neglecting your own needs.
Who won?
Me,
Big or small?
okay,
Big or huge?
huge.
Huge. That's awesome. I'll concede to Jill because she has one that you will not be able to argue with.
I was high-fiving you, giving you a virtual high five.
Yeah, high
Awesome.
five. Yeah, here's my high five.
It's great to see your momentum going. So, but Haral, you are failing as a mother.
I knew this was coming. Okay. Yeah, so like I said, a lot of times I do fail, and yeah, I mean, yeah, I think when I'm failing, I'm also learning to be more humble, and just telling myself that uh, please do not expect him to know so much, even if he understands a lot of things way ahead than his age, because you are also someone who fails despite being so elder to him. So I think it's okay to fail at times, and um, again get up and then fail again. I mean, this is how life is. Otherwise, we wouldn't be human beings. I mean, yeah, I mean, there's no such thing as having like 100% in like 100% grade in parenting or something like that. So I think, yeah, what I'm teaching my son is to not be perfect at all, because it is so tiring to be perfect, and there's no such thing as perfection.
And who won that, you or me?
Yeah, me.
And was that big or small?
It was huge.
It was huge.
It was,
Awesome.
Are there any thoughts left? We could go over all of them, but look at there were 8 negative thoughts, and are there any that I can attack you with that still seem potentially threatening?
I think I will ruin my son's future if I am unable to
Oh, that
handle
was my next
everything.
choice. Could Hiral, this is a fact that you're going to ruin your son's future. In fact, you already have to a great extent. if you are unable to handle and nurture him well, and you are unable to handle and nurture him well. So his future is doomed.
No, I don't think so, because if if I look back at my own journey, so I've grown as a human being. Kids always don't rely and depend on their parents and what they've learned from their parents. I mean, I've learned and unlearned so many things. So eventually he'll also, he'll also learn and unlearn a lot of things when he grows up in life, and he will have full freedom to explore and choose the path he wants to walk on. So, I mean, it's, it is all, his future is always going to be in his hands. My only job is to uh, help him. Yeah, just my only job is to, just support him and be with him, irrespective of uh, you know how he is doing or where he is in life. So yeah, I mean, I'm not, I'm nobody to decide his future, or yeah, his future is not in my hands. It is in his hands.
Who won? Big or small?
Big,
Big or huge?
huge, huge.
Huge, beautiful. And how did you get to huge?
I think the fact that you know, like when the time that I realized that I'm just carrying unnecessary too much of burden on my shoulders, and eventually kids grow up and then they choose their path, and like, because we were allowed to choose our path, so I mean, we will also give the same thing to our kids. So then why worry? I mean, we are, even if I'm not working, uh, the fact that I'm a good human being, so I'm doing well. I mean, yeah, but I just discounted everything, and now that I'm talking, I'm just recollecting, and everything is coming up. So yeah.
Yeah, awesome.
It's amazing, Hiral. I mean, I had chills actually, just hearing you talk. I just want to say I'm so moved by the beauty of what you're saying. And I'm hearing you talk back to all these negative thoughts, but really like on such a deep level of acceptance of your son as a human being who's going to be who he's going to be. And I don't need to take so much responsibility for his every move. And that sounds very freeing, but also what a beautiful parenting philosophy, that you're just realizing that the burden of all of this like control and criticism and
Mm,
perfection is so unnecessary, and you look so much freer to me, like just
um,
sort of embodying this philosophy. It's amazing
Yeah.
to see.
In fact, let's see how you are feeling now. But I just have a question. Do I sense a book coming from Hiral?
no.
Okay, let's go back to the daily mood log here, and well, are there any negative thoughts that we need to
Yeah, that's a
challenge
good
still?
question. Anything else we need to conquer here on your daily mood log that we haven't yet? Any other negative thoughts that are still kind of niggling?
Not really, but I think I would like to try this one. I should know everything.
Yeah, Hiral, you should always know everything.
Yeah,
I'll
I
show
think
you
I,
I'll show you how to answer that one first. You be the negative, Hiral, and I'll be the positive.
okay. Yeah. Hiral, you should know everything.
I know, and I do.
How is that true?
That was my attempt at humor. It didn't work.
No, I just wanted, yeah, okay.
Yeah. Okay, Hiral, you should always know everything.
Yeah, I think I like knowing everything, but um, I also know that I don't know, because I uh, I just I just prioritize certain things in my life. So, and it's okay. I mean, there's no need. And eh, of course, it at times I do feel lonely, because it becomes very difficult for me to connect with people of my age. But then again, that's okay because their values and my value system is really different. And the way they look at life and the way I look is also very different. So then uh, I just have to let it be. And yeah, that's okay. I mean, like different people can coexist and that's okay. And I mean, I think that's the beauty of life.
Okay, who won that one?
Me,
Big or small?
big,
Big or huge?
huge.
Huge. And now let's do a role reversal because I'll give you my serious answer. And you can say, Hiral, you should know everything, or David, you should know everything.
Okay. So I should be the negative one,
You
negative
can be
leader.
the
You're gonna
negative
hit
one.
Okay.
Yeah.
Hiral. Yeah, David will be positive Hiral, and you'll be negative.
Okay.
Or I'll be
Yeah.
positive David if you prefer. You can say, David, you should know everything, or
Yeah.
Hiral, you should know everything.
No, I would say, David, you should know everything.
You know, somehow when I was young and foolish, I kind of was on that kind of trip thinking I was going to be a perfect therapist or a perfect researcher. And it really got in the way of closeness. And I can remember the day I was with a patient who said, Dr. Burns, you're not helping me. And it used to threaten me when I heard that, because I used to insist that I could help them. And I remember looking at her and saying, you know, you're right. I haven't helped you at all. The tests show you've been depressed every week for weeks and weeks. And everything I've done hasn't been helpful to you. And I just want you to know how sad and ashamed I feel because I have so much warmth and respect for you. But I can only imagine how lonely and depressed you've been feeling and disappointed. And I really want to hear what you have to say. It's so important. And that was the first time I'd ever said anything like that, except the fact that I'd failed. And she started sobbing. And then she said it was the best session we'd ever had. And after that, she started working really hard and turned her depression around fairly quickly. And you know what I've learned is that you know, the older I get, the more mistakes I make, and and that my mistakes are just a chance for humility and for learning and growing. And that's not knowing everything. Man, if I knew everything, I'd be ready to die, I guess, because there would be nothing left to learn. And learning and growing. And today I heard about this woman Hiral who was very closed off at the beginning of the session and reminded me of the early David. And what a joy it was learning how to work with her a little. She taught me a lot. I hope this kind of growing and learning never stops.
Yeah. I feel so warm now. So I think just to
Yeah.
go back few hours before, I think now I feel very connected to both of you.
Yeah. Yeah. Beautiful. Thank you. Yeah. Thank you. Um, well, let's see. So we've done our, yeah, we've
Yeah.
done on, no, let's do our final feelings now.
Yeah, on the daily mood log or on the
Yeah,
brief mood survey? Which one
on
are
the
you
daily
asking?
mood log.
Yeah. Okay. And I'll just do the last screen share so people can see where we're looking at. But go ahead, David.
Yeah. Right now, how down and unhappy are you feeling? Zero, great. So put a zero there if you have a way of doing it. I'm putting it on my copy here. How anxious, worried, nervous, and frightened are you feeling?
Zero.
Zero. How bad, guilty, bad, and ashamed?
Zero.
Zero. How inferior, inadequate, and defective?
I think 5%, but that's okay.
Yeah, that's right. That's good. We don't want to let go all of that. That's like pure gold. How lonely are you feeling?
Zero.
Zero. How embarrassed and self-conscious?
Zero.
Zero. How hopeless?
Zero.
0. How frustrated?
0.
How annoyed, irritated, and upset?
I think 5.
5. Great. Now I
Yeah.
have just 2 final questions, and then I'll turn it back over to Jill. The people would see these numbers and say, here's a person who in one session went from 100 to 0 on 8 or 9 different feelings, to, or to 0, or on most of them, and 5 on 2 of them. Um, she's probably just saying what she thinks he wants to hear. So the first question is, did you really experience that profound change in your feelings? And then secondly, what would be the 1 or 2 or 3 things that did it for you? Like what would be the most helpful part of the session that brought about that uh, dramatic change?
Yeah. So I think first thing was that everything was written down on a piece of paper. So it was very easy for me to identify that what is exactly going on in my head, because there are this continuously self-criticism is there, and then I'm just putting it down on a piece of paper, and then I'm going a little more deeper inside and seeing that what is it trying to say and how is it helping me. And also the fact that when I was talking and I was doing externalization of voices, there was a way of talking back to these negative thoughts in a positive way through these techniques called counterattack and acceptance and all. So, so I think that was something that really worked for me, and also the positive reframing. That really saying that these feelings, these negative emotions, are actually helping me to become like helping me in some way. So yeah, I think these were few things that really helped me. I mean, um, because I was just constantly talking and thinking only negative, so there was no way out that I was able to move in another direction. So I think the tools helped me to, open that locked door, or the door that I was, looking for. So something like that. Yeah.
Beautiful. Well, what a joy it was, not only to help you in my professional role, but to feel close to you, to get to know you, to see the flower open up, the orchids open up and blossom before our eyes here. Thank you so much for that very loving and beautiful experience. It couldn't have been more awesome and jaw dropping. Uh, I'm so happy for you. I'm so happy for your son,
Mm.
and for all the people in your orbit, and you're going to evolve into such a fantastic uh, 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 and flawed therapist.
I feel so happy
You can
hearing that.
join the club of the flawed therapist. Um, openly flawed therapist. Yeah, I just wanted to comment too. I mean, of course, what a beautiful session. What an amazing opportunity to connect with you. Such a beautiful and vulnerable and flawed human, as we all are. And I also had the sense that the positive reframing allowed you to really connect with your values, right? And in connecting with your values, that's really what then shined through in the effective externalization of voices responses, right? It just kind of kept coming back to this, like, this is the kind of person that I want to be. This is the kind of mother that I want to be. And it was one, and this is the kind of child that I want to raise. And it was really one that would be thoughtful and flexible and, learning and growing rather than perfect and stressed and critical. And
Wow.
you really came to this, like, kind of, I need to live this way so that I can model it for my son, because this is how I want him to live. And it
Right.
seemed like your most effective responses were kind of along those lines, which I thought were super beautiful, and I'm guessing kind of had their roots in the positive reframing, right? Connecting to that
Yeah.
kind of side of yourself.
Yeah. That's right.
Yeah, and that you could be, you can be flawed and such an unbelievably loving and caring mother, and you can make mistakes and be a loving and caring mother. In fact, those two things totally go hand in hand.
You look so
So,
soft and beautiful right now, Hiral.
Yeah.
and relaxed. You look so relaxed. Yeah,
Yeah, that's
you
true.
do. You look kind of in bliss mode.
Yeah.
Yeah. Um, David, and Haral, so kind of what we were thinking about was we can spend more time doing this for a little bit if we'd like, and then we were gonna share a couple slides just with the audience about kind of if you thought this was interesting, how you could learn more, and then we were gonna do Q&A with the audience. So the audience can ask questions of David and I about what they saw. They might even have a couple of questions for you, Haral, about your experience. So right now, the audience should be sending any questions they have in the chat box to the panelists, and Mike is collecting those questions. So, David, should I share my slides and we'll kind of do the
Yeah, let's
learn
fly through our
more?
slides and max our time for Q&A with our audience. And
Okay.
thank you all. You've been very patient, and now is your chance to participate in the dialogue and
Yeah.
share your questions and your reflections and your thoughts and so forth.
Yeah, and so I'll share slides. We'll kind of do a little learn more, and then I'll stop sharing slides and we'll do more Q&A. And again, we can, Haral, if you have more thoughts that you want to share with the audience about what worked or didn't, or any learning points, I think everyone would love to hear from you too. So let me do that right now. And don't forget, you can just send questions right now in the chat box, and Mike is going to collect those, and then we'll answer them. So essentially, I'm just putting this in here, and then again, we'll come back to more Q&A and sharing. But we just kind of wanted to share with you, now that you've gotten a taste of the TEAM CBT model, we'd love to also share with you ways you can learn more. We actually got a lot of questions in the chat box about, this looks great, but how in the world would I do this with my patients? Or I'm really inspired to want to try to do this with my patients. So we just want to share with you this opportunity. This is a brand new kind of subscription that we're offering. And over the years that I've been teaching and supervising therapists, I've heard from so many therapists that they want a place to practice and get feedback and want mentorship and a community. And so we've kind of created something that brings all of that together in one place called CBT All Access. And the CBT All Access, actually, I'll stay on that for one more minute, is a monthly membership that includes practice and consultation groups. It includes certification and the fast track course, which is a weekly course with home study, and then practice and feedback sessions each week, and special events like this one. David's toolkit is included. And so it's like a whole sort of learning ecosystem where you can learn and grow and practice. And it includes the fast track course, which some people who are here have actually already been a part of. But this is a kind of 6-month course that has about an hour a week commitment of learning and practicing with us. And then home study videos that you can watch on your own, including lots of awesome interviews with David and instructional videos with me. Um, and this is just a slide that shows the many, many techniques. You got to see us do a few of these today, but we actually teach and practice all of these techniques in the CBT All Access. And last, I'll just say, it's the prices on the bottom. It's $115 a month. You can cancel anytime. So kind of a monthly subscription. And if you're not super thrilled, you can even cancel the first month and get your money back, because we definitely want to provide you with a really awesome and inspiring and helpful learning experience. So yeah, that's on there if you're interested, and hope to see many of you in that. And then I'm going to invite David to share a little about the Feeling Great app.
Well, this is something I've been developing really mentally for, I'd say, 40 or 50 years. I first conceptualized it in the late 1970s, and finally found a group that would help me develop it, Jeremy Carmel and a number of others. But it's an app that does, exactly what I do. We've trained the AI in the latest version, which we're just finalizing, but there's a fantastic version already. But it does what you saw us do over that 2 hours. But the app goes through those stages, TEAM, with you, and it's free for you and free for your clients currently. It'll only be available until about September because we're going to run out of funding in September and we'll have to go out of business at that point. So it will disappear in September of this year in all likelihood. But it is, I think, the greatest development in the history of psychiatry and psychology. And I'm just sad that, we couldn't make it work on a business level. But you can try it out and use it all you want between now and then. And if you're a therapist, it will just boost your effectiveness if you refer to your patients. Sadly, it's only in the U.S. For now. We had hoped eventually to make it available worldwide because there's tremendous demand for it worldwide. But again, we have a very small staff and limited resources, and that means going, I think, to do well. We'll do that if we can, but our resources are pretty limited. But anyway, that's the feeling. Great app, and it's people say it's fantastic, and and it is. And the new version we're just finalizing now is going to be even more amazing. But it's already jaw dropping, and it's just something for you for free.
Awesome. And in addition, we also had some free weekly practice groups. So David and I do a Tuesday evening psychotherapy on Zoom. We do a practice group and a training group. It meets on Tuesday nights from 5 to 7 p.m. Pacific. This is just for therapists to learn. And you do have to make a weekly commitment. Your commitment is to come regularly, but it is a free training group. And we teach and practice TEAM CBT skills. And then David has a YouTube channel that you can find on YouTube and watch tons of David's stories and videos and snippets. And that's, also a wonderful free way to learn. And then David's got a podcast. I'm trying to think if there's anything else we wanted to say on this.
No, the podcasts are free. Almost
Yep.
everything I'm doing is for free.
Yep.
And like today is for free. I was taught that the best things in life are free, so I've tried to do as much for free as I can, and it's more or less paid off with a lot of joy. Well, let's get on to Q&A, and also that Jill and I have a free class at Stanford that's open to therapists from all around the world. We have many from India, as a matter of fact, Hiral, but it's Tuesday nights, and it's 2 hours, just like the webinar today. Although this was 4 hours, but it's like a 2 hour version, and you learn and you practice techniques. So you'd all be
that was what
welcome.
I talked about right here, the weekly Tuesday group from 5 to 7. And
Oh yeah,
Yep.
yeah. That's how you join it, by email edwalton100@gmail.com if you're interested. Yeah.
Okay, so so wait, I'm gonna leave. Let's see. Okay. I'm gonna leave this on just for a moment, and then I'll stop screen sharing so we can do questions and you can see us large while we're answering questions. Mike's been amazing today, responding to your questions in the chat and giving you guys some prompts and some thoughts about what's going on in the session. So now Mike is gonna share some questions with us.
Excellent. And just before I do that, thank you all so much for your comments for Hiral. I think there was 3 pages of love for you, Hiral. And so I'll be passing you that all along to her. Questions. Testing. I like the idea of the evaluation of the session, as several of my clients are people pleasers. I wonder if this will encourage them to tell the truth about me.
It will encourage them to tell the truth about you, and you won't like the truth. When people use my scales for the first time, therapists, they generally get 100% failing grades with 100% of their patients 100% of the time. The scales are set up. They're very sensitive to therapeutic failure, and don't use them unless you're ready to tolerate the truth, because the truth is the big problem. But it's not that the patients won't tell you the truth; it's that they're going to tell you the truth. And the question is, do you have the courage to face the truth and learn that as a source of growth and learning? And the answer to that is you probably don't. Most therapists don't. They'd rather go on in a state of shitty bliss, thinking they understand things that they don't, and not knowing how your patients feel and how your patients feel about you. But if you're crazy and want to transform your practice, that's the way to go.
The beginning, when you were acknowledging Hiral's point of nervousness that she was feeling, did the therapist ask questions like, would it be okay if we move into your feelings you wrote on the brief mood survey? And did you do this to get the client on board with the work they're about to enter, or do you prefer a more directive approach, saying, let's get into the work, and now we'll get down into business? When you're going over the brief mood survey and then the scores on the daily mood log, you're asking about different emotions. Were you doing that as an effort to try and move them forward to get to work, or just to connect?
Yeah, I think that when we are going over the feelings on the brief mood survey, which is really the beginning of a session, right? A patient will come in and hand you their brief mood survey that they completed in the waiting room or online at home. And we're just going over that in an attempt to actually really understand. There isn't an agenda to push them forward. It's really just an opportunity to listen, to connect, and to make sure we understand. It sounds like you're feeling inferior at an 80%, right? That's it, that kind of a thing. Or I should say, sorry, I was thinking of the daily mood log, but you're feeling, angry of a 4 out of 4. That's pretty intense. So empathy.
Yes. Is the daily mood log ideally provided to patients to fill out prior to a therapy session and then identify the distortions, or something you typically do with them during a therapy session?
The first time we do the daily mood log, I generally do it with them because I have to teach them, because there's a tremendous amount to know about it. It's just a form on a piece of paper, but it's evolved over 20 years or 40 years, really, of meticulous evolution and modification. They even have to learn what is a negative thought. Because just because it's raining today, well, that's a negative thought, but you wouldn't put that on a daily mood log because it's just a description of the weather. So there's a lot of teaching involved. But after the first time you've done it with them, they should be able to identify upsetting events, circle their feelings, and write their negative thoughts. And so then they can start working with it on a daily basis at home for part of their homework. And the patients who are willing to do that have a tremendous prognosis for full recovery. Patients who refuse to do the homework have a tremendous negative prognosis for improvement.
A number
Yeah.
of people noticed. Oh, go ahead, Jill.
Oh, I was going to just say a little bit because I noticed there are some questions around the daily mood log, the cognitive distortions and
Yeah,
stuff. And
some of
so
those are coming up.
what I would just acknowledge is, for today's demonstration, for the sake of efficiency, we definitely asked Hiral to identify a situation, circle the emotions, and rate them, and write down the negative thoughts that she was having. In fact, when we requested volunteers, we basically said, if you would like to demo with us, please do this first. And so one could do that without even having any therapy. Just pick a moment in time, circle the feelings I'm having, and write down what are some of the thoughts that are driving those feelings. But the reality is, obviously, when we have a patient in front of us and we're doing therapy with the patient, the first time, as David said, we'll actually walk through that slowly and carefully and show them how to do it. We will also, after doing the assessment of resistance, like you saw us today do event, feelings, thoughts, no methods to change, just the positive reframing. And then we come back to identify the distortions, right? So it looks like it's all one thing on the daily mood log, but we do take a step away from the daily mood log before we start using any change methods to do positive reframing, which you saw us do with Hiral today.
Great. And there's a few questions that I think that answered, Jill. So that was
Yeah.
fantastic.
People are asking about the flow of the therapy
Yeah.
session, which makes a
Yes.
lot of sense. Yeah.
Yeah. And a number of people noticed that she'd filled out the distortions already before you guys did that. And so she was aware of them and was a little bit ahead of the game.
Right, right.
She's very
Yes, but we would always do positive reframing, and then we did a variety of kind of paradoxical agenda setting methods before we started working on identify the distortion.
Yeah. There's quite a few were asking about self-disclosure and how much do you share regarding your personal experience. David did some and then brought to life some of Jill's journey. And so some said, we were sort of taught that you're not supposed to do self-disclosure.
Yeah, I was taught that too. But my supervisors in residency were psychoanalysts, and they said, "Don't ever tell anything about yourself at all. Don't ever share your feelings. Don't even say anything to the patients. Just sit and listen. You're going to treat people without, using voice or words, which have evolved over millions of years to communicate." But when I use self-disclosure, it's a spontaneous thing, but there are certain rules about it, and one is I'm sharing something personal that will convey to the patient, I've been there, I've had that experience, but also there's hope and change because here's how that led to a really a fantastic outcome. So that's part of it. And then part of the sharing also is to develop emotional connection. Because when I shared toward the end, Hiral, you said, now I'm feeling closer to you, David, when I was talking about that, when I said to that patient, I've really failed. And then she suddenly opened up. So I think it's an art form, and it can be abused. There, like all powerful techniques, can be abused and require a lot of practice. But that's my thinking about self-disclosure.
Yeah, it's very intentional. It's not, I feel like telling a story, so I'll tell a story. It's, the goal is trying to connect and empathize, maybe share feelings and share a feeling as well that we're all kind of in the same boat. But actually, I wonder, David, maybe we could even ask her all, how did you
Yeah.
feel when David did self-disclosure, when I did self-disclosure about my own perfectionism and parenting? What was it like for you, for us to use self-disclosure?
I think, yeah, so the fact that, I'm going to be doing this demo with you all was so overwhelming. And then also learning that, okay, you all are still making mistakes. And when David said that the more old you grow, you make more mistakes. So I felt so comfortable. I mean, I felt so normal. And I was telling Nivedita ma'am that, ma'am, I want to feel normal throughout this entire demo because I was feeling very anxious. And that's what exactly happened. I started feeling normal by the end of the demo. So, yeah, I mean, yeah, you just feel connected. I mean, you don't feel that gap, this gap, I mean.
Yeah.
Yeah. Yeah. That's wonderful.
David, during the positive reframe, you asked a number of questions after you would come up with a benefit, like, is that correct? Is that true? Is that real? What's the purpose of doing so? And do you repeat less of that depending on the client?
Well, and when I'm doing positive reframing, I want a breakthrough to occur. I want the patient to see something about them that's really true. I don't want this to be a rote exercise, like go and look at a chart and write down the positives of your feelings, because that kind of horse shit has never been effective. The Buddha pointed that out in his famous uh, paper entitled Horseshit, which he wrote in 2,500 years ago and published in ancient India. Right, right. Isn't that right, Hiral?
You can just shake your head at David.
But the what was the question now? It's slipped out of my brain.
When you ask them, is that true? Is
Oh
that
yeah. So
real
when
or
so
positive?
when I'm asking them, I'm saying, is what you're saying true? Is it powerful? Is it important?
Mhm.
So the person will suddenly see, yes, this really is. And Hiral, you did. And if the person can't say those things, can't see it, you have to empathize and get back on the same page because you're in a little different universe from your your patient. But I think it's very important. I think it also puts the patient in a yes set.
Mhm. Yeah. I wonder if I could just make one quick comment before we go to more questions, which is a question in and of itself. David, I was just thinking that we didn't give her all homework yet, and I want to make sure that we don't forget to do that. And I suspect there's some questions around that too, almost like we worked with her for 2 hours, right? And we saw such dramatic and amazing and meaningful and real change, and sort of what comes next, and what might we suggest for homework. And think we also got some questions around, there were some other issues Hiral was struggling with. What happens with those issues? You want
And
me
Jill
to?
will now answer all those
Yeah, I
questions.
was about to say, would you like me to? I'm happy
Yeah.
to. Yeah, well, I mean, regarding homework, what I would say is first off, we would say, Hiral, when you are doing this work with us, I think you are not necessarily writing down your positive thoughts and rating them and that kind of thing. So my first homework would be for you to take your daily mood log, with the extra questions that we had on it, and actually write down all positive thoughts. There might be a few that we didn't tackle as well. So do the positive thoughts column for all of your negative thoughts and percent belief and after and that kind of thing. If you're at all struggling with any of them, I'd encourage you to use that externalization of voices kind of exercise yourself. You could always also use the Feeling Great app. But I think in terms of the perfectionism, that's what I would recommend is just finish that out. Will you have more perfectionistic thoughts that will crop up? Will that come up again for you? Yes. And when it does, my recommendation, but I'll be happy to hear David's, but my recommendation would be to start actually with positive reframing. What is this thought showing about me that's beautiful and awesome? How is this thought serving me well? And kind of remind yourself that. And then go to, okay, but what's a positive thought? What's a rational response? How could I think about this differently? How would I want to be telling myself? And to expect that you're going to need to keep pulling out a daily mood log and working on these kind of perfectionistic thoughts if they come up for you again.
Yeah.
That's my first. There was a second question, but David, did you want to comment on that part?
Yeah. I think as far as what comes next, I'd say two things come next to Hiral. One would be relapse prevention training, because all of this will come flooding back, even more intense than it's been in the past, and so we want to prepare for that, and that takes about 30 minutes. And so we could, if you wanted to do it in a demonstration role play, maybe you could come to one of the Tuesday groups, and that's evening time. I don't know what time that is in India, but it's 5 to 7 p.m. here in California. But that would be one way to do it, and I think that would be incredibly important. Once someone is recovered, there's an absolute certainty that they're going to relapse many times for the rest of your life. And so let's just figure out how to handle that. A temporary relapse is fine, but I don't want my patients to go back into months of misery. And and then secondly, if there are other issues, again, maybe you'd come back to one of the Tuesday groups and we could do them as a demo if there's interpersonal issues. But you have to see how far this magic carpet you're on right now takes you, because you're really in a beautiful state. But if there are other undone things, the interpersonal model is radically different from the one we did here today. And so that we could dip into that, or anything if there's some undone work. But I think as far as your perfectionism, you've learned, you have everything we have to offer except for the relapse prevention training. There isn't anything more there to learn. You're enlightened at this point in time,
Yep.
Great.
which
You
is
guys are hitting
cool.
it. You did an A+ hitting on a number of the questions with those answers, so that's fantastic. How do you do this in a 50-minute session? For those that are limited to 50-minute sessions, how would you do this?
I personally would never do it. I think it's a curse worse than the plague. And it's just too expensive. My patients can't afford a 50-minute session. A 2-hour session is free and it's one and done. 50-minute sessions drag on endlessly. However, a few tremendous experts have learned how to do 50-minute sessions. One of them is with us, and she will tell us how to do it.
I suspect I suspect you have two with us, maybe three, but I think Mike probably does some 50-minute sessions as well, right?
I do a few, but I really lean towards David's approach because I love the double sessions myself. So
Yeah. So if the question was, how do you do this in 50 minutes? What I would say is, yeah, you have to break up the model a bit, right? So yes, you're spending empathy and maybe getting into agenda setting in one session, and then you're perhaps giving a daily mood log and having someone articulate, thoughts and feelings. You can give them homework to better articulate that in between sessions. And then they might come back to session and you have to be very direct in the beginning of the session, checking in with them, asking, looking over the brief mood survey. But essentially my goal is to say, here's what we were working on in the last session. Here's how far we got. Let's pick up where we left off and let's keep working on that. And so it's just a question of being kind of diligent about staying on track. But that happens even if you're doing 2-hour sessions. If you're seeing someone for multiple 2-hour sessions, it's the same. The art is the same. It's the art of being able to stay with something, from week to week, right? And David, when you do follow-up sessions with people, you do the same thing. You don't start over from the beginning. You summarize the work that you've done, and then you say, and here's where we were at, and here's where we're going. Let's do the work. I would say the difficult thing, no matter whether you're doing 50-minute sessions, 2-hour sessions, or intensive therapy, is being careful not to just listen, and never, kind of offer what we call an invitation, never try to segue from talking to working, right? And kind of keeping your patient and yourself accountable. And I think there's a lot of skill and a lot of art associated with that. And all of those tools we practice a lot in our training groups too. The art of staying on track with the patient and holding your patient and yourself accountable for doing work between sessions and within sessions.
And I'll just reiterate a statement I made earlier that probably went in one ear and out the other, but that Jill and I will make this look really easy and simple. And that's a trap. We're conning you because it's not. This is the hardest form of therapy in the world to learn. And each step of the TEAM exists on multiple levels. And when you try to do it initially, you're probably going to run into a lot of failure. And that's why we offer both paid and free training, because you have to come and be willing to fail as fast as you can and learn and grow and accept your flaws and imperfections. And over time, if you stick with it, you can get better and better and better. And, when I was a psychiatric resident, I didn't even dream that it was possible to work as fast as we did today with Hiral. But it came about as a result of a lot of trial and error and failure and learning over time. And my patients have taught me because of the tools, because of looking at the scores before and end of session. And like today, even the score within the session. Oh, well, what was the acceptance score? Well, I can't really grade you guys. Well, what I'm really saying is you sucked. But here's why. And then we can deal with that and make that a part of the session. But all these things take a lot of skill on multiple levels, including your own enlightenment.
This question really kind of leads out of that one where somebody was kind of struggling with a positive reframe. They have a client that they can't think of anything positive for a particular extremely negative thought or emotion. What do you do if you or your client can't think of anything positive or beneficial? For example, like it said suicide, but I'm thinking, deep hopelessness.
Yeah. Well, I just
hard
ask
for people.
around, and someone else will give you an idea. I can remember when I would develop positive reframing for negative emotions was the first thing. The hardest one for me was frustration. I couldn't think of anything good about frustration. And I was frustrated because I needed that to complete my list of how to reframe any negative emotion. And I was down, I don't know what brought me down to Mountain View on Castro Street, but there's a kind of an internet cafe type of thing where you go up on the second level. It's kind of like a balcony thing or something, and you can get coffee there and work on your computer. And so I went up there. I'd never been in there. It's kind of a cool, popular spot on Castro Street in Mountain View. If you're ever there, you'd probably enjoy it. But there were all these people working on their computers, and I couldn't figure out what's good about frustration. So I finally just said out loud in the restaurant, I said, listen, I'm sorry to interrupt you, but I'm working on a project here and I'm stuck. I'm trying to think of what's positive about negative feelings. And the only one I can't think of any positives is frustration. What's good about frustration? And then someone shouted out, it shows you haven't given up. And I thought, wow, that's right. Because if you've given up, you won't be frustrated. And like that. But I really worked at it with my patients and so forth. And now I can positively reframe anything. If someone asks me once, I bet you can't think of anything great about being a serial killer. But I was able to positively reframe that also. I won't let the answer out because people get too shocked by it. But there is something really positive and awesome about being a serial killer.
Yeah. Actually, I will say that, David, I don't know if you remember this because you have an unbelievable memory for these kinds of things. But the first time that I was just struck by the beauty of positive reframing was actually in David's kitchen during an early Tuesday group, like, 17 years ago or something. And I was consulting on a patient who was incredibly hopeless. And it was positive reframing of his hopelessness, a patient with bipolar disorder. Oh, I totally
Yeah.
remember it. It was so powerful, and then I went back, and practiced it with the patient, and it was totally pivotal to him and in becoming motivated and really letting go of his resistance, but also really honored kind of exactly what he was going through. And so just to say that with positive reframing, I do think we're at a point where it's hard to imagine anything a patient could throw at us that we couldn't positively
There's
reframe.
nothing I can't positively
Right, but
reframe.
but it's from practice, and
Yeah.
we do that all, we do so
Well,
much kind of case consultation practice. We think about
yeah.
this all the time. And
Yeah.
I would say in David's toolkit, there is a list of the most common, let's say, thoughts and feelings and kind of positive reframing advantages and positive values.
But that's why we have the groups, because you'll get stuck on everything
Right,
like that.
right.
It all seems simple, but it's not. So
Yeah,
you join a group, you practice, you learn from colleagues, and you learn how to learn.
right.
It's also in David's book, Feeling Great. So a little plug for the book, Feeling Great. So you can get that
Yeah,
in
yeah,
there.
yeah.
And David, you said this earlier that one of your rules is you wouldn't ask one of your clients or patients to do something you wouldn't be willing to do. And so I highly encourage people, do your own daily mood log, take your emotions and positively reframe your thoughts and emotions. And that's where the powerful learning can happen when you do it for yourself.
Yeah.
How often with the same patient do you use the magic button? Like if, like you said, Hiral had two roads that could have been worked on, individual or interpersonal. If the interpersonal was worked on next, would you go through the same process with the magic button?
I don't use the magic button on the interpersonal. We have a whole other powerful procedure. We don't have time to go into it right now, but it's a whole different theory of causality and a whole different set of techniques.
But I think the question, I agree, but I think that got embedded in the question. But I think
Right.
the question was really, let's say you're working with a patient and you use the magic button and positive reframing, let's say in one particular thing. Do you walk through that whole sequence if you're working on something else? At least that's one way of hearing the question, and I'll answer that, which is yes, if I'm working with a patient on their perfectionism and we've done positive reframing and they've gotten some enlightenment there, but now I'm working with them on, their social anxiety, and it has a different feel and a different flavor and a different set of negative thoughts, or their panic attacks and they're afraid of their heart racing and things like that, and it's really like a very different kind of bucket of feelings and thoughts, then yes, I'm definitely going to walk through that same sequence, because in that case, I need to show them what's beautiful and awesome about this set of thoughts and feeling. And it doesn't get old for patients. In other words, I could even say, you've heard me ask you a similar question, but I just want to think with you, what are some benefits of telling yourself A, B, and C? So
I've had patients come back to me for free tune-ups, and I think it was just so that they could do some positive reframing.
right.
They enjoy it so
Feeling
much.
proud of their negative
Yeah.
emotions and their
Yeah.
symptoms, right? And it's a
Their-
beautiful thing.
Their new skill set.
Yeah.
Regarding the magic dial, when it comes to having the client come up with the goal percent for a particular emotion, should we encourage them not to choose 0? Like, are you sure you're feeling 0 anxious is enough? Or if they said
I
0.
think you had some zeros and low grades and 20. They were kind of all over the map, and that's kind of fine with me. But if someone chooses all zeros, then they probably haven't connected with the fact that there's some really positive things in their negative thoughts and feelings.
And you can paradox them on the spot then, David, because you've already done positive reframing. So if someone were, just told you what are all the amazing things that their guilt shows about them, and then they say they want to feel guilty of a 0, and that doesn't jive, it doesn't make sense to you, you could always say, sure, you'd want your guilt at a 0. After all, you just said that your guilt shows A, B, and C about you, and that it really is working for you in these different ways, right? Would you really want to get rid of that? And the reason that we do that again is really kind of a resistance busting tool, because we know there's going to be some good reasons to hang on to just a little bit. And so,
And the acid test is a way to shock people too. If we had a woman whose daughter had been shot in the face after she let her go out and play one night, and some neighborhood boys snuck up and shot her in the mouth, and led to 9 years of misery. And her goal was to feel happy by the end of the session. And it kind of didn't jive. And I said, and she thought she'd let her daughter down. She thought it was her fault. She'd suffered too for 9 years. Said, oh, I see. So by the end of the session, you'd like to feel happy and joyous. And she said, yes. And I said, yeah. So you'll feel happy and joyous about the fact that your daughter was shot in the face and has suffered for 9 years with surgery and therapy for post-traumatic stress disorder, and you want to feel happy about that. And she said, oh, no, I want to feel sad and upset. So it brought her around really fast. That's called the acid test.
Honor those emotions. Jill, I'm looking at the time, and I know it's getting very late for Hiral, and I thought it might be nice to have her share a couple of comments. Can I
that's exactly what I was thinking.
Okay.
Exactly what I was thinking too.
Exactly. Yeah. And then I want to make sure we have an opportunity to say thank you to Hiral and to say goodbye to the audience too.
Thank you for not only what you gave yourself, but what you gave the elderly David, who was grateful for what you gave him. He told me that at the break, and so I know that from the horse's mouth. But all these people, you've given a tremendous gift, and we want to thank you. Boy, somehow this went into slides or something. And
I just wanted to go ahead. We can still see Hiral and hear her.
Okay, yeah.
I know, Hiral, it's quite late into the night now for you. You're probably getting quite tired, but maybe a few words from you on what this has been like for you.
Yeah, so I think it has been amazing. I did not imagine that it would be so nice. It was so smooth, and I would encourage all the participants to grab this opportunity of having to experience what it feels to be a part of such live workshop, because then only you come to know how it really works. I mean, like Jill said, that you got to do your personal work, and that's how you know that how it is effective on the clients as well. So yeah, that's very important. And I can't thank enough. So, but still, thank you so much for breaking that defensive part of me. And
Oh yeah, wasn't that great? We killed it.
you did. Yeah. So I just felt some rays of hope entering slowly and gradually. So thank you so much for that.
Well, I'll make sure you get all the comments from everyone because it's been coming in and I haven't been able to keep up actually. So it'll take me a bit, but I'll get them to you. So you get them in the morning.
And I
Okay.
just want to say thank you to you, David, for guiding all of us today and for your kindness and humanity and your just beauty and artfulness in bringing the Team CBT model to life. And I always just marvel at how you take your time at each step of the way, and we always land in this incredible place at the end. So it was really always is kind of jaw-dropping and inspiring to work with
Yeah,
you,
yeah. It's
and I
always great working with you, Jill, because I know no matter how much I screw up, you're my safety net. Here's someone with compassion and intelligence whose brain still works and who's a fantastic teacher who could make me look good. And Mike, it's always I love you, and
Mm,
it's like a miracle having you at these presentations. And I also want to thank Maor Katz, the head of the Feeling Good Institute, for making all of these events, including many free events, available to all of you. And thank you for supporting our work and attending today.
David, I love you too, and there's a lot of love coming to you through the chat as well. Your gift, your brilliance that you were willing to share with the world, and a lot of work and pain in that process. And we just are so grateful for you.
and thanks to everybody for joining us today. It's not easy to be a passive participant in watching all of this unfold. And so we hope that you learned something today. We hope that you were inspired, and we'd love to see you continue to learn and grow with us in the future. And just really glad to have been a part of this experience. And thank you so much, Hiral, again for sharing your heart and your brilliance with us today too. So thanks, everybody.
Thank
Take
you.
care.
Bye-bye.
Bye bye.